And members of the committee, I want to thank you all once again because your perseverance and you guys attending this each time as committee members and your commitment to improving and making sure that DCFS and us on the same page. I want to thank you, and I want to thank Ms. Cannon and I want to thank Ms. Peck for the work that you continue to do on this. So thank you very much. I appreciate it. Madam Secretary, we kind of know the format. We keep it real informal. We'll have an open discussion. Want to thank you in the department for everything you're doing. So why don't we just begin the discussions? And members, we're on item number 3 of the agenda, oversight of the Department of Child and Family Services related to the division. And we'll maybe go over the handout you gave us and welcome.
Thank you so much, Senator Mills. Mr. Chair, can you guys have the microphone on?
Oh, I'm so sorry.
That's okay.
If you're waiting on me, it's going to be messed up.
Good morning, Mr. Chair and members. We also want to extend our thank you to you for your interest and your assistance with serving children and families in Louisiana. We're very happy to be here with you because we know that here we find support and we find good questions that help us to actually go back and make sure that we're doing the very best that we can. So I wanted to say that it is Women's History Month, and it may be notable that DCFS has the highest percentage of females compared to every other state agency in the state. We employ 90% women at DCFS. And though in our diversity, equity, inclusion, and belonging work, we continue to right size that so that we actually look like the rest of the state. As far as all types of diversity, including gender, we hail all the workers, and particularly just want to give a good shout out to all the women and men of DCFS for all the very, very important work that they do. I'm joined at the table today by our Assistant Secretary for Child Welfare. She'll be up here soon, Amanda Brunson. But it's my pleasure to introduce you to our new Assistant Secretary for Family Support, Ms. Ashley Sias. Since you'll hear from Secretary Brunson later, I'd like to ask Assistant Secretary Sias to introduce herself to you.
Welcome to the committee, and thanks for joining the department.
Good morning, and thank you, Secretary. I am Ashley Sias, Assistant Secretary for Family Support. I've been serving Louisiana families for the last 14 years at DCFS. I've worked in various positions with the agency, and I'm glad to be here right now with the Secretary and helping to move families forward here in Louisiana.
Thank you, Ashley. And you may be hearing from Ashley as we go forward. We're going to talk about a few things, she and Amanda, and of course we have other staff here to make sure that we can completely answer any questions that you may have of us. So when Amanda comes up a little bit later, Assistant Secretary Amanda Brunson, we will go over the 7 strategies, and then she will also bring up some very special guests that we have. We're happy to have several members of the LEAF board here at the request of Senator Barrow, but it's our pleasure to bring them forward. The Louisiana Elite Advocacy Force, the LEAF board, made up of former foster care youth who bring their lived experience and voice to several programmatic efforts that we have in the department, and we try to do that in an increasing fashion for more effective service delivery to families. At our last oversight meeting, I told you about the end of the SNAP emergency allotments. I shared that as a result of the passage of the Federal Consolidated Appropriations Act of 2023, beginning in March, SNAP benefits for all recipients nationwide, not just in Louisiana, have returned to their regular amount. These emergency allotments have allowed households to receive the maximum SNAP benefit for their size with the minimum supplemental allotment amount of $95, meaning no household received less than an extra $95. As you know, each case is different, as the amount of benefits is calculated based on the individual household. I shared last time with you an example of a household of 3 with income. who might have been eligible for $335 per month in regular SNAP benefits, but with the additional emergency allotments, that same household has been receiving $740 per month, the maximum benefit for that family of 3. Now, with the end of the emergency allotments, that family in March and going forward will go back to only receiving $335 per month. So that's $400 in that example that that family of 3 would no longer have for food benefits. Now I'd like to share with you an actual case, a Louisiana story that I heard yesterday through one of your offices. Miss Mary was receiving, as a single person household, $285 during the pandemic emergency allotment period. Now that the emergency allotments are over, she is receiving her regular benefit amount, $20 a month. From $285 to $20 a month. What came to our office is, quote, she is a cancer patient that has to make lots of trips to Lafayette for care. Could someone please look into and call her? We can look into it and we can call her, but we can't do anything about the benefit amount. The other thing is we have 471,118 households on SNAP. We will not be able to call them all. And so we will really need your help.
I think you, as we do with our interactions, Senator Mizell did want to kind of jump into the conversation.
Absolutely.
Senator Mizell?
Thank you, Mr. Chairman. When you're saying that, and you may not be the right person, but the woman, Mary, is that her name?
Miss Mary.
Miss Mary. What benefits are you the point of contact that could tell her, okay, well, we can't give you SNAP, but this is available and this is available, or are these options? So what is available to her? If SNAP is taken off the table, literally, what is there for her? Because I find this, and I'm asking this because I find we have just a plethora of resources, but until somebody points it out, it never gets to the point of need. So are you that point of contact for her?
So every communication that we send to them, we put the message, call 211 to find about other resources available to you in your community. So it's helpful to remember that DCFS administers federal programs. That federal program is not there anymore, right? We don't have another program. But we have, as I've reported to you guys before, entered into an arrangement with 211 where that agency, their everyday wake-up mission is to give people information about resources and refer them there. And so all of our communications say to our neighbors, if you have any need, find out what resources there are in your communities by calling 211. The reason why I think this is important is we reached out this morning to the DCFS call center. I'm expecting an uptick in the number of calls coming to the agency. What we have found an uptick in is the number of people calling 211 asking for food resources. Not necessarily yet the uptick in calls to my call center. I think we have done the communications department every time over the last 36 months we were giving out the extra allotments. We've been letting people know that the extra allotment was an extra allotment and that one day it would end. So since January, we've been saying the extra allotments are coming to an end. If you need resources, call 211. Right. And that is the answer. Now, let's be clear. 211 will give information about resources available. If the resources run out, they will run out. There are a lot of different places. And so I think it is a time for us to really be thinking about what other resources can help families for food needs. And there is quite an intricate array of services available, but none of them have unlimited resources.
But that's my question, is that it is the time for us to tell families where the
That's
other
right.
options are. So is 211 doing that? does Miss Mary know where the food bank is? Does she, you've got a willing listener and a great opportunity to say,
That's what we do.
Okay, right. So you're giving them their whole array of
Correct.
options.
Well, we're
on-
giving them 211 to find out what their array of
How
options
many calls
are.
does 211 had? Do you know?
I don't know. When I contacted Sarah Berthelot of Louisiana Association of United Ways this morning, she was only able to give me, we have an uptick. I don't have the number yet. So just to keep in mind, the extra allotment would have hit people's cards Sunday.
Okay.
And so this is the week that people are beginning to realize like that extra allotment is not there. So I'm expecting as the week goes that we may have more calls. And we will be. We get monthly and sometimes when we need like this, weekly reports from 211 about the increase. And so we will be able to report how many calls are coming in for food needs. I would say to you that this may be a time where each of us as neighbors, we might think about how are we sharing food, either personally, but also given to the food banks. Feeding Louisiana is sort of the lead of that effort.
Yeah.
And I think we might be considering how we might plus up that resource. We put an article in your packets. It's a national article.
Yeah, saw that.
There was
Washington Post.
several states did not extend with the public health emergency these benefits. So several states ended them earlier than we did. So we pulled it as far as we could until the Federal Consolidated Appropriations Act was signed. And I think you will see that that article is in a rural area, mile-long
Right.
wait
Right.
for a food pantry.
Right. And I've seen that. I've seen a line through way out of my town all the way into the center of my town.
That's right.
So that's realistic. But, and I don't want to take up so much time, but
it's okay.
just so I understand, the people who have a SNAP card benefit right now, how do they know that? How are they going to be aware that when they go into the store with that card, there's not going to be the money on it?
Yes, ma'am. What I can list
That's
to
a
you
nightmare.
the
That
plethora
frankly
of
is a
ways
nightmare.
that we have communicated with them, including by letter, including multiple text messages, including
So you do, okay.
Oh, yes, ma'am. We have done, and we'll continue to contact people.
My fear was that it was at the register, and that's horrifying for a family.
No, ma'am. We are pushing information out to the public because we know that this would be very difficult. And when we push it out, we push out call 211 for local resources, right? But, there are churches that have, hot meals on Wednesdays and things like that. I think we just have to be aware all of the 471,118 households have a decrease. So
Right,
it is
right.
a lot.
You
right?
warned us on this.
Yes,
last
ma'am, we've
meeting,
been talking about
I appreciate you giving this a heads up. Thank you for
Absolutely.
your time.
Yes,
Thank
ma'am.
you, Mr. Chairman.
Thank you very much. I'm going to turn it over to Senator Barrow, but one thing, just so we'll know, what are the qualifications to be on SNAP? Like, what is the income level? Is it, tell us who is that person that now that we're moving forward is qualifying?
So, Senator Mills, I can ask Ashley to give you that information, but I want to be clear, like, this is not like Medicaid, where it's about you qualify or you don't. This doesn't make anybody lose qualification. Everybody is qualified, it's just they're getting a reduced
It's
amount.
just the quantity. But I will tell you
Right.
that, and I'm going to turn over, I did have some really close friends of mine that were making a larger amount of income that in the emergency received these cards that were like, I don't need this.
And so there's a couple different things. Like, I received a pandemic EBT card, which is different than SNAP, but looks like SNAP and spends like SNAP. And that was a different federal program. Now, I turned mine over to the food bank, right?
Okay.
Or whatever. So pandemic EBT was a Department of Education feeding benefit that was basically like my child was in a public school in Baton Rouge, and every child that was in public school in Baton Rouge qualified because of the poverty level. That's a different program. There is a PEBT program. We can talk about that a little bit. There's going to be a summer EBT program, but it is different. So I want to make sure that we're not swapping them out.
Well, what we'll do, if it's okay with the committee and everybody, we'll finish this topic, and then
Okay.
I think we should go through your punch list of
Yes.
threats, opportunities, because
Absolutely.
that's our main focus. We want to
It is,
we want to
sir.
hit what you're accomplishing, what you're not, and where you kind of having still some sleepless nights as the
Yes, sir.
secretary.
So what we'll do is we'll send you the, as a response, all of the eligibility information about SNAP. So you'll have it at your fingertips. It is on the website.
Okay.
And the reason why I think this is so tied to what we're going to get to is about 50% of the calls that we get really are about people who need resources, not necessarily about on the child welfare side.
Understood.
It's about people that need resources. So we want you guys to be just like us. We have increased 3,500 employees to understand what 211 is, to be advocates for having people call 211 to find resources that we don't have as a department or the state doesn't administer. And they would be also receiving information about federal, state, and local resources because 211 catalogs them that way.
Okay.
But thank you for that.
Okay. Madam Vice Chair, all yours.
Thank you, Mr. Chairman. And my question is going to be really quickly. Is there a movement, Madam Secretary, on the federal level, since this is a federal program and the cost of food is really almost quadrupling daily, to actually revisit this issue, not as a part of the pandemic, but just as a part of the need? Because we're not the only state that's grappling with this. Many states are. Many people are finding themselves in this insecure situation. So, are they considering it? Is there a conversation among the secretaries in the states to let them know how big an issue this is? I mean, I know they know, but it's such a multi-layer issue. And when you look at California, I'm just going to say this as an example because they are experiencing the snow and the flooding and etc. They're going to have their own compiled issues, and they were just talking about just trying to even get food, right? So is there a national conversation for the federal government to really revisit this issue?
Yes, ma'am. And the department, through multiple venues, is working on the farm bill. So what we want to be looking for is the farm bill. That's what they call it, right? And that's where SNAP fits into the farm bill. I think, there's always multiple ways of looking at SNAP and all the other things. But I think it's important to know that we're not keeping our hand off of this issue. We're keeping our hand on this issue and providing information about what it takes for a family to be economically stable, and therefore stable in other ways so that children can flourish in their homes. And so we subscribe to several different mechanisms that allow us input, insight, and a voice.
Okay.
That includes, APHSA, don't ask me what that stands for, American Association of Public Housing, something like that, public health. And we work directly with CPPB, Center for Public Benefits,
Policy.
something like that, CPBB.
Public policy.
But the point, right, is that also our federal partners regionally, they're looking also.
Okay.
And so it's important to realize, though, that it wasn't the federal agency that made this decision. It was a congressional act. And so really, we need to be working with our congressional
members.
delegation to understand how this impacts Louisiana and what they might be able to assist us in doing to making sure that we can at least meet the food needs of those in Louisiana, where food is so important to us, not just on our tables, super important for families and children, but also for our farmers. And to that end, I do want to just point out that this legislature did pass an instrument last year that is allowing benefits to go further. So if there are certain, and I think you have something in your packet about, I'm going to get it again, grow the good, which is something that helps both families and farmers, so that if you take your EBT benefit to a farmer's market or other stand where a farmer is an EBT provider, though they do have to be an EBT provider, then the organization allows them to get, say, $1.30 or $1.50 for $1 worth of EBT, worth of benefits. So this is a very important program. There are some grant opportunities that we are applying for to continue to look for opportunities where every dollar can just go a little bit further.
And so I'm assuming that this information is available to the general public for those individuals, so they
That's
know
correct.
about
And if they
this.
call 211, they would find out that information as
As
well.
well.
It's on our website.
Okay.
And then we have sent it to all your chamber laptops so that you can also use your social media advocacy and continue to help us get the word out about these good programs like this. And we'd love to see, I think the legislature gave $1 million to that program in the last budget, to see that grow more. This, of course, brings healthier foods into the household, incentivizing healthier foods, stretching the SNAP benefit, and then also providing benefit to the farmers. So I know that we're eager to get to the next
Last
thing.
question.
Yes.
Did I hear you say that we're going to have the program for the youth in the summer EBT program?
There will be a
There will
summer
be?
EBT program.
Okay.
Yes, ma'am.
Okay, great. Thank you. Thank you, Mr. Chairman.
Oh, thank you, Madam Vice Chair. Are we
Thank
ready
you,
to go with that
Ashley.
spreadsheet?
So, one more thing before we go. Food security is so important, but also so is child support. And I just wanted to let you guys know that right now in in Baton Rouge, the state association for all the people that work on child support begins their conference here in Baton Rouge today. It's called the LSEA conference, with lots of different partners, including DAs and our staff and national partners, including the person who is assisting us with increasing our poverty competencies and understanding about what our neighbors are going through and how to better serve them. Dr. Donna Beagle is presenting as one of the opening speakers of LSEA. We'll be talking about that work that we're doing with her in the future. But we will have one bill from the department during this session. It is a child support enforcement bill. In your packet, we have given you a letter that we received from ACF, our federal partner, helping us to understand that there is a state mandate right now for a mandatory minimum on child support to be $100 a month. That mandatory minimum for a child support is against federal law, and we'll need to remove a mandatory minimum in order for us to keep our child support money and our TANF money. And so it seems very straightforward to us. It's like of course, a judge is the one that will always be determining what the right amount is, and so this will be just to remove the mandatory minimum. So that is the one thing I wanted to bring to your attention before we move to.
So you wrote for guidance. They gave you back guidance, and basically on the second page it basically said that that applying the state guidelines should result in income-based orders. So,
Yes,
Okay. So
only.
you asked for guidance. That's the guidance they gave you.
Yes.
Okay. Very
So
good.
we filed this bill last year based on them telling us verbally, and then everybody at the legislature looked at us like, we're not doing this until you get a letter, so we got the letter. So
Okay.
there's the letter.
Very good.
And of course, what's at risk if we don't do it is $250 million of federal dollars for all the families that we're talking about already. And Senator Bowie has agreed to bring the bill.
Very good.
All right. So hiring fairs leads us right into both of our all sides of our agency, but particularly family support and child welfare. And so due to the collective focus that we've had on hiring, as well as the improvements that we made in our overall hiring process, our hiring has outpaced our separations by 72% since July. So at the start of this fiscal year, we had 3,263 FTEs on board. Now we have 3,589 FTEs on board. So we have increased the number of people working at the department by 326 people since July. That's a plus, right? So it will take several months before all of the different efforts will result in more stable services in the field. Even if we had all the available field positions filled, all the available positions filled, we would probably need more to handle the workload. And so now we're going to turn to child welfare. And
So-
with that, I want to tell Ashley, thank you for coming to the table. I'm so glad that you're working with us in this role.
Thank
And
you.
as Amanda comes to the table, I'll pause for the
But
chair.
just to recap for everybody, you have the spreadsheet that's ongoing.
Yep.
In red, you basically have this secondary sheet that talks about what's going on. And then you have the historic sheet that goes back to the dates of where the meetings are.
That's
So-
right.
So anything that we see in red, we can go to this document here, and we'll have a further explanation.
Man, Chairman, you got it. Thank you so much for that.
We should, after like the 10th time, I better get it by now.
Well, I'd say that this is what happens when you work well together, and I appreciate that.
Okay,
And
and
as
before we get started,
Yeah.
Senator Pope had a comment.
I want to go back to, thank you, Mr. Chairman. I want to go back to a comment you just made about the new employees that you've had since, I think, July,
yes, sir.
300 plus, I think
Yes,
that's
sir.
the number. I'd like to ask a little bit, and I'm sure y'all doing major training and all that. What are you doing for the training and the length that it takes to get these people, what you would think up to standard to go out into the field and do the work?
Yes, sir. I think that most people that work specifically on child welfare and also in family support will tell you that it really takes years for them to really feel like they know what they're doing. But
Never
the
do.
truth,
Yeah.
the truth is that it definitely takes about 6 months to get someone in a full-time caseload, right? In a full caseload, and you know, with that, I wanna share with you that we have been looking at various ways to make sure that there's good learning transfer. So, for example, Senator Pope, at one point we thought when we're training a CPS investigator, we put them in the classroom for a week and then in the field for a week to put that into practice. And then we put them back in the classroom for a week and vice versa until 6 weeks passes. At one point we thought we're just going to knock out the 3 weeks and send them to the field. And there's no way possible. The learning transfer falls. It's too much to take in at the time. And so I appreciate the leadership in child welfare has looked at various ways of iterating training. As we learn more, we do better. As we try something like that, we measure it to determine whether or not it worked, and then we went back to our regular training. Also, that someone who is in training, when they first come out, they're only going to get a partial caseload until a certain amount of time before they get a full-time caseload. And so with that, and using your question as a little bit of a segue, which is why I wanted to make sure that while we move into this area, we recognize that our investigations are up 33% this year over our 5-year average, right? So if the trend holds, it'll translate to nearly 6,000 more investigations in 23 than there was in 22. That's a significant number. So while we are filling our positions, you can see that with that type of increase, you probably need more positions to handle the increase in workload. I'm concerned that as the fentanyl crisis continues and as the food need and other things, that we'll have to be thinking towards where are we going, not just where we are. But if we look at where we are right now, there is also an increase in the urgency. And what I mean by that is 74% of our cases now require a 48-hour response time, whereas our 5-year average is 66%. Right, and so
Well,
even
I
that.
don't want to interrupt you. You gave me way more than I needed, but I understand, I appreciate that. But
Okay.
the point I wanted to try to make, and the reason I bring it out, is the fact that we have to understand, and the people in the Never Never Land out there that are working has to understand that even though you've got these new hires, they're only going to be limited for a period of time, that it does take the training. Because I think I've heard y'all say, sit at that table right there, multiple people say, we don't want to send them out there if they're not ready to go.
That's
We
correct.
can't do that. That would
Thank
be
you.
more damaging than any good we would ever do. But that's the point I wanted to make. Thank you, Mr. Chairman.
Thank you.
Very, very good point. Before you get started, I tell you one wonderful thing about these committee hearings. So many people listen to it, and one of the constituents that talked to me about the EBT cards that you talked about, I feel like now I have a talk show. So they've sent a text message to me, but I want to fulfill that.
Okay, good.
The people that did receive a pandemic EBT card through the school never used it. Did the money go back to the federal government, or what percent was never used? Do
Yeah,
y'all know
so
that?
we would be able to give you a report about what percent was not used, and yeah, it would go back to the federal government because it's a federal benefit. So it expires at a certain time. As a matter of fact, it used to be that it expired 365 days later, and the feds changed it, and it expires a little bit every month because they were given those benefits by month for a while. So after 6 months, they start rolling off. So they expire, they go back to the feds.
Back to the feds. Okay, thank you.
Yeah, so those federal benefits never come into the state's budget. They go directly from the feds basically to the individual. So if the individual doesn't use them, the feds basically still have it,
Gotcha.
if it makes
Thanks
sense.
for doing that. We took a little
Absolutely.
detour, so we'll go back
No
to our
problem.
timelines.
Okay, good.
Oh, I'm sorry.
Quick
I think
question. One quick question to follow up on Senator Pope's question as it relates to the new hires. So when they come in, are they making the same amount of money or the workers that are already there? Or because I know that we did like the pay schedule raise or whatever. I'm just trying to see in terms of the level of fairness. And then what's the number or percentage of them, I know it's still probably early, that have decided, they came in and said, hey, this is not for me.
Absolutely. So we do have quite a bit of data that helps us to understand. I think we've had 12 of these hiring fairs over
Okay.
time. And approximately, we've seen like 1,200 people to get the ones that we got. And then we've given a little bit over 600 job offers, but then that yields about half of that in the end, right? I don't know if I have in front of me right now the number of people who started and then said, Uncle, I can't do this, but I know they exist. We actually talked about that in Baton Rouge the other day. This person who was like, I want to help. They get in there, and then they do the work, and they say, oh my God, I can't do this work. So we try them on 2 or 3 other programs, and they're like, I can't do this one either, right? And so they moved away.
Good morning, members. Amanda Brunson, Assistant Secretary of Child Welfare. I just got a message that the retention rate's about 90% for the new hires
Okay.
so far.
So once we get them in, right, so we have several that either don't pass the background check. So when we give our hiring, when we're at the hiring fair, we take them through interviews, we take them through various things, and we give them, you are hired, conditional. Then we run the background check. Then we check their references and those types of things. So definitely there are some people that fall out. And at that time, there are some people who also just decline. So in the end, I think we get about 50% on board from those who we give a you are hired sheet to at the hiring fair. We're yielding that. The amount of time it takes us is probably 5 weeks compared to 4 months before. So the tweaks that we made are significant. And we can get as deep into that as you like. I have Mr. Toby Como here that can go through all of that as well. And particularly on the child welfare side, Deputy Assistant Secretary Leslie Calloway has been working on the child welfare side with Miss Amanda. So we can talk about that as much as you guys would like. But we're very, very happy to be able to show that we can hire. We know how to do it. We definitely had to make some hard looks at it. And I'm so proud of the human resources staff. I do not want to downplay how important it has been to have Louisiana Workforce Commission at the table, as well as Civil Service at the table, and the Office of Technology Service, and the amazing support that we've been getting from the Commissioner and the Division of Administration to make it happen.
I do not want to get into the nuts and bolts of, how how it's set up right now. But that's something I think I would like to know myself personally, so I come in and have that visit myself. But what I do want to talk about, Mr. Chairman, and I don't know if this is the appropriate time, is just structural things.
Okay.
So pay, to me, is an issue. 90% workforce, while I'm happy to hear that, then why is that so? Because right now, based upon what I know, most of the individuals who work in this field are probably some of the lowest paid state workers in the state. So I'm wondering, is that a factor, and how do we begin to address it? Because that, to me, is the long-term issue, and structurally, how do we begin to fix it? And I don't know if this is the right time, and if not,
Why don't we do
I would
this?
yield to that.
Yeah, why don't we do this if the
Okay.
vice chair is okay with it? The first page from A through F basically talks about recruitment, communication. So why don't we tackle that, and then why don't we drill a little harder on F, which is attract staff, pay incentives, and we'll drill down on the vice chair's request there.
Okay.
Is that fair with
Sounds
everybody?
good.
Absolutely.
Okay,
Thank
well, why
you.
don't we do this? So let's kind of talk about A, and it looks like you've completed a lot of the job fairs, and it looks like where I'm seeing the green that's moving forward is recruitment activities. So we see what y'all have done. We see where you've moved the needle. It seems like on the first section of A that there's some areas of like Lafayette, it's been one job fair, other areas more job fairs. So why don't we talk about it's been completed, what's been your success, what's in the future, because you will have some more attrition, you will have some more retirement. It seems like this would be an ongoing activity. So why don't we hit A, and we'll hit all those activities, and then we get to F, we'll really talk about what the vice chair is wanting to do on that.
Before Amanda gets started with that, let me just say that we went through every region in the state purposely because there's a need all over, but there are greater needs in certain areas. And so we have had to focus like a couple of different times in Baton Rouge, a couple of different times in New Orleans, where our yield was not as great. And if you think about the competition that we have in New Orleans, you got more people, but you also have more employers in New Orleans, right? And so the competition in Baton Rouge and New Orleans is also higher. So if you're not paying well, then I can find another job a little bit easier. So we will continue to be doing that, and I have a meeting scheduled with Byron Tuckertoe of Civil Service this week, where we will be reviewing many of our efforts with Civil Service, because as you know, that some of the pay that we have had approved that he testified to when he came is temporary, and even though it was extended, it's still temporary. I think what we're seeing is that the market shows us that we'll have to stay there or hire in order to continue to hire the right personnel. So it was interesting to me when I made a visit to the DC Child Welfare Agency that every person on their CPS staff is a licensed clinical child welfare worker. As you know, we don't have that as a mandate, but also their starting salary is $75,000 a year, right? It's a higher area median income there, but at the same time it helps us to understand that there are many ways to create and craft a workforce, and the work that Miss Amanda has been doing along with the rest of the staff allows us to look at what's available in Louisiana and craft the right workforce for Louisiana. Lots of inputs for us to make decisions on.
Yeah.
We're not looking for just today, but looking into the future too.
And it seems like from what the vice chair wants to drill down on, we'll do more, but it seems like A through E can't be successful without the right pay incentive.
That's correct.
I mean, you can have as many outreaches as you can, but when people ask what the bottom line of your salary expectations are, it seems like that has to be tackled first. But so why don't we talk about, in the upcoming next few quarters, more job fairs, more outreach, that type of thing on kind of all of that first page?
Absolutely. We will have additional hiring fairs. I took off the shaded, when we thought they would occur, because this is really a reset point. We just finished having them all around the state. Now we have to stop and take stock of all the people who came through those events. Are they getting into the positions? What does training and onboarding look like? And now what's left? Where do we still have gaps, and what programs and what regions? So we are doing that evaluation kind of work right now, and then we'll be able to map out these next couple of months. What does the schedule look like to repeat some of these hiring events? Because they have been very successful. And I'll tell you, I think through those events, we have about 96 new caseworkers who are coming on board. Either they're in seats right now, or they're in training, or they're scheduled for the next round of training. And so we will begin to see the impact of this. But to Senator Pope's point, if you look at kind of that 6-month span that it takes from the time that somebody is officially sitting at their desk until they can take a full caseload, it's really, right now, we're seeing people who started in like August, right at the beginning of this crisis. And so it's just, we're hopeful. At the same time, it can be sobering to think, wow, we've been to this table so many times, but Rome wasn't built in a day. It's just going to take some time before all of these people really are in, fully trained, and able to carry out the work and able to take a full caseload.
Okay, so you just keep moving on. If I see the board has questions, we'll go through. So I'm looking at B, and B says that one of your red items that you have a little note on, that you're in contract negotiations to contract with a communications firm. Mm-hmm. So all of the other parts of design, solicit, conduct communication, that's been in-house, and you're looking to outsource some of that?
Right. This shows up a couple of times on this timeline. One is a campaign to recruit and retain staff. One is a campaign to recruit and retain foster caregivers. And then another piece is about kind of the prevention component and services available, like how do we support families versus report families. So all of that is rolled into this contract that we are working through the process right now. So some of it's internal work, and then it'll be plussed up a lot by the ability to do this contract.
So just so we can have our spreadsheet kind of up to date, when do you hope that the contract negotiations will be executed?
We've been back and forth between the vendor with the scope and the division, and so in all of that work, I think it could be within the next couple of weeks.
Okay.
It's just been, you move things to one stage and then you come back and clean something up. So
I'm with you. The board's clear, so we can go to C.
Sure. So C is about the improvement and simplification of the hiring process. That clearly has been a success. I will say just one quick note. We are down to, as of yesterday, I think 55 vacancies in child welfare, and 51 of those are be-on positions, which means somebody is working for the agency already. They just have been temporarily detailed into something else. So when you look at true vacancies, we have 4.
So before we all kind of got together and we had this crisis, where was that vacancy number?
It was in the hundreds, a couple of hundred, I think.
That's great.
I have that
That's
somewhere.
great.
170.
170.
in
Wow,
child welfare.
and that is fabulous.
Yeah, so help is on the way.
No, that's fabulous, and I think we ought to clap. We got to celebrate when we hit something, y'all.
do.
Okay. All right.
So expanding and deepening the hiring pool, we are at the point of kind of evaluating. We changed the minimum qualifications to be able to open the gate a little wider and get more people in. So we're at the point of evaluating the impact of that. The university outreach, we talked about how do we get students in before they graduate so that we're kind of building a pipeline of future DCFS workers. So we've kind of recalibrated that program a little bit and are beginning to recruit students.
You know, I was
Right.
hearing, I'd heard a podcast with a newly elected governor in a state, and this was a passion of his. I forgot his name. Very young governor, and he said that he's trying to develop in like a DCF atmosphere major internship programs, even for
That's
high
what that
school
is.
students, to just get in there, because once you get that service of government, it just kind of bites at you. You want to do it.
I think we might be able to move to high school students once we figure out this one. It's taken us a while, actually, to kind of crack the code, but the 2 things have come out of the effort, and I love when you try something and what you learn from it. So as we tried this, we learned that we needed a little bit more run time before, prep time before we could run. So we're in the process of recruiting students to start in the fall, in the summer and the fall. But in the meantime, what we learned or we're reminded of is that students in their last semester, they can apply for DCFS jobs, I think it's 60 to 90 days before they actually get their degree, so they can get in the pipeline. So now we're recruiting for those regular jobs, those who are in their last semester, while we're also recruiting for those to be in interns.
It was, I looked up the podcast. It was Governor Wes Moore. He's newly elected in Maryland, and he has a robust training program where he said he's starting to get some retention. So just
Thank you.
FYI.
Thank you.
Sure. Madam Vice Chair, all yours.
Yeah, really quick question. So are there any particular universities that you have been working with?
Yes,
Or
so-
is it all of them, or?
Well, right now we're starting in Baton Rouge as a first. And so,
Okay.
of course, we're working with Southern University and LSU, but also we've been working through a professor at LSU with Franciscan University, where the nurses are. Also,
Okay,
remember that
yes.
we're hiring nurses and some others as well, right? So there's some crossover opportunities for people, I don't know, who want to cross over into service in this space instead. And so there's no one off the table. It's just that
Okay.
in the first program, it's going to require them to be in person. And so it's just about whether or not they can get there. So we're not taking anybody off the table, but we have a limited number of spaces, right?
Gotcha.
So as long as someone's willing to come to Baton Rouge a couple times a week, they can
makes
be in the
sense.
program. And so we know we have such great universities in this area that once we learn from this, the intent is to bring it statewide.
Okay.
So we want to learn first, see how it works, and then be able to move it a little bit more quickly, faster. And while we're in this section, I do want to say to you that, before we started this, the annual starting salary for a child welfare trainee was $29,700, and now it's $36,500 based on the special entry rate. And then if you're working,
Which is temporary, right?
the
No, this is not.
the SER kind of holds, but it can hold, but it's effective. Yeah, it can hold, but the bottom line is that I think that we don't need a special entry rate. We just need a real salary for child welfare, right, for this work. So this is what we're working with Byron on this week at Civil Service.
Okay.
And so what is temporary, more temporary, is the $5 an hour in Baton Rouge and New Orleans to kind of plus up all the work that's going on there. Those are the temporary incentives that we're using right now.
So we went from 29.7 to 36.5 since last year.
And what we did was, we also did do an increase to the salaries of the persons who are already here, 10%.
Good.
Yes, ma'am.
Okay.
And then we are paying overtime right now as well in those areas. And so that goes all the way up to managers at time and a half. So we're doing what we can in this crisis, but like you, I don't see that we're out of crisis anytime soon. So we are a crisis agency, right? So when the state is in a state of crisis, we are the ones doing that work. And so I know you asked that question specifically, so I wanted to make sure to answer it while we were in one,
Okay.
Chairman.
Very
Okay.
good.
Thank you.
Senator Pope?
Thank you, Mr. Chairman. Back to your internships, and you're getting those second semester of their senior year, high school?
So, no, these are college internships.
Colleges.
Right
Not-
now, we're
not-
college
Well, I was under
internships.
the impression you were just talking about K-12, high school.
Not yet, not yet. So right now, if we started in high school, which is a really good idea,
I think
they
it's a
won't
great
yield
idea.
us
I'm trying to
anything.
promote it.
Yes, we won't yield what we need right now. So our focus right now is making sure we plus up, and we're hoping that if the governor's budget continues on, or your budget continues on to give us more, we need to be able to hire more immediately. And the high school students would not be able to work this work in child welfare right now. No,
Okay.
yeah.
You cleared it up.
So, but we're getting there. We're getting there.
We need to bring you out to the real state,
Yeah.
in the free state of Livingston. I can show you a place where we work.
Okay. Yes, sir. Thank you.
Thank you very much, Senator Pope. Appreciate that. So we really are now on pay incentives. I mean, I think we covered everything there. So why don't we dig a little deeper into what the vice chair's thoughts are, and y'all have that dialogue right now, and I guess, are y'all doing kind of market surveys? Because Senator Boudreaux and I were at a CEO forum, and CEOs right now are saying they can't get like minimal workers for $20 an hour. It's really critical. I mean, we had that talk yesterday, and the labor market is tough right now.
It really is.
So why don't we have that dialogue, and
Okay.
y'all tell us where y'all going with civil service. I'll turn over the mic to the vice chair, and y'all have your discussion.
So I think you really led into it very well, Mr. Chairman, because it's a tough market, and I believe that people almost have to be called to this arena to really want to do the work, and the people that are there, for the most part, I believe do feel like they are called, because they're certainly not making the money. But I do want to know, what is the path forward? And I see that we made that's a significant increase from last year, but we still, in looking at comparison, it's nowhere close. And I mean, a person that's making $20 an hour actually makes more doing probably less work.
Absolutely, especially work that you can leave.
Yeah.
When you, as my dad would say, knock off. You're done with it.
Right.
Until you get to the next day. Of course,
Yes.
These cases do linger with you, and so our conversations with civil service will be talking about that. We need to talk about when civil service, and they are responsible for bringing to the table what is the right assessment in the market. And so I believe that we need to look at where else are we looking? Even a licensed clinical social worker in the school system makes way more than one that would come to DCFS. So Byron has been, and all the staff at Civil Service has been super reasonable, working with us. But this is where we're getting to. What is the right market for us to analyze? Because people who have callings, they also have children that they want to get home to,
Right.
And other things. And so I think it's important that we are not only making sure that they're getting paid well, properly, but that they can actually go home at the end of their shift, and they can go home with a mindset that someone else is going to take care of the calls that come in at night. And so that's where some of this work is how do we get a 24/7 group of people working for us, so that when someone is supposed to get off at 4:30, they can actually get off around 4:30 or 5, right? And so a lot of the other 7 strategies are also helping us with that work-life balance, which is another critical part. So when we do our research, and this is what I'm getting my PhD in, is human resource development and leadership, right? And so the research tells me that if I can make sure that people hear thank you, right, a lot, and if I can pay them something that they can actually feed their family on, and then if I can give them some work-life balance, they're going to be able to keep their calling. Not just be called, but feel like they can keep their calling. And so I think that's a super important part. That's why, and I have to keep applauding the division and civil service for sticking in there with us and giving us what they could. The commission has given us what they could right now until we can go back into and look at what is the right scenario to set those salaries properly. And I think, just as you guys have said, now is the time to actually look at today's market for the type of persons that we need to make decisions in these extremely difficult cases. It does require somebody that has more training than just a bachelor's degree to get to decision making. Not all parts of the cases, but certainly some of the decision making. And so this is where we're sort of arm wrestling a little bit.
So a couple of things come to mind. As you guys are preparing for your budget, not for this year, because this year's budget has already been submitted, but going forward, And as you are meeting with the department and beginning to strategize and begin to look at it, how are you beginning to prepare and move forward? Just like the data you gave us about the 74%, that's a high percentile from 1 year increase. How are you beginning to, prepare for that and making sure that we, the legislators, understand that, so that as you are crafting the budget, we are understanding the need, and to make sure that you are able to keep moving forward. What I don't want to see happen, because I do believe that we are gaining some momentum and we are beginning to move some things structurally. But we have a lot of work to do, and just like you said, Ms. Bronson, Rome wasn't built overnight, and we can't turn the ship overnight. But we have to make sure that as we turn in the ship, that we don't begin to revert and start going backwards. And that is my concern. One of my biggest concerns is, as we are planning and moving forward now, how do we make sure that we continue to move forward? Because I wish I could say that I felt confident that the drug epidemic that we have in our state and across this country was going to get better. But I don't feel that optimistic. The more we see more of a decline in this area. And it's very troubling because they're getting younger and younger. And my secondary question to you guys later on is going to be, when we know that a family's in crisis, how do you guys come in, even if you're not a part of the initial intake? Like, I'm going to use FINS. Families in need of services. How do we connect those services to ensure that when we know that a family is in crisis, before they get to DCFS, how can we begin to help to mitigate it so we can stop the bleeding, right? Or try to at least help and lessen the bleeding. But again, let me go back to my initial question. How are you guys beginning now to make sure, and it's going to be upon us once the budget is submitted to ensure that that happens, but how are you guys beginning to plan that, and what does that look like?
Yes, ma'am. So we do extensive analysis on our caseloads and the number of cases coming in, which is why I kind of started with that, right? How many calls are coming in? How many investigations do we have to do so that we can do caseload analysis? That is how we usually turn in our budget requests from the department, based on caseload analysis. We've got a lot of feedback from both legislators and the administration that in order for us to be able to get more case workers and support staff, that we have to be able to evidence that we can hire people. And so we're hoping that we are evidencing to you that we can hire people so that we can continue to right size the case staff to the caseload. And I do think that it's important in Louisiana that we do budget annually, so that if for some reason DCFS ever had too many workers, you could downsize it. It's been a long time since I've been able to say that ever happening. But that being said, we will, we actually learn sometimes from, the fiscal staff and the legislative auditors, et cetera, about different ways to do analysis. But we work very hard with the other child welfare agencies across the nation, and with the Child Welfare League of America and the various other organizations, to make sure that as others are analyzing these, so are we. So we have lots of data that we can turn over to anyone who wants to sit and think with us about what do we need, and what is the appetite to increase or allow the resources for us to have. There's always a dance with making sure that we are able to provide you the information that you need to make good decisions on the fiscal side, and our ability to actually administer well. And so, that's why I love these meetings, because we've been working so well together.
So let me ask you maybe a little differently. So for the next 5 years, do you guys have a projection of what this could possibly look like, your department, and what the needs may be, and what that budgetary need may look like?
I'll say that what you don't see reflected in these 7 strategies are a lot of other things that we're doing and talking about within the department. And one piece of that is exploring really what does the structure in the field office need to look like. I mean, that's really where the rubber meets the road. And so not only is it, do we have enough caseworkers based on our current caseload standards, which we also could evaluate and say the work is a lot more complex now, and maybe the current caseload standard may not be the right caseload standard, right? But, and then what else is needed? If people are not staying with the state for 20 years, what can we reasonably expect somebody who's very new to the field accomplish if they're only going to stay here for 1 to 3 years? So how do we restructure the front line? These are all things that we're talking about right now. We're talking about a full assessment with civil service of the child welfare job series to see if that needs to align differently. So there's this whole conversation happening about how do we really look at the field offices and what's needed there to strengthen it. At the same time, there's this whole conversation about how do we look at the state office in child welfare and see, do we need to make some shifts just so that teams can really focus on my mission is safety. My mission is permanency. My mission is well-being, to better align and help. Child welfare is also by nature full of crises and emergencies. And so this team behind me and then all across the state, every night, every weekend, there are groups of people on phone calls together trying to triage and figure out a particular situation, staff a case. And so how do we make sure we spread those emergencies out in a way that really helps us with retention and helps us address burnout from everybody who's doing this really heavy work? So there are all of those pieces of it. But then I will say, too, that we've heard time and time again, like, that the vacancies were a barrier, right? Like, how do we give you more whenever you have vacant positions? So the fact that that has changed now is continuing to change. I will say that if I could snap my fingers right now and add new positions to this child welfare division, I would be adding about 325 what I consider basic needs kind of positions, more people on the intake line, people who are helping to be on-the-job trainers of all this new staff, new caseworkers.
See, that's good information right there.
Right.
That's very helpful.
So it's part of a process.
Okay.
But these are all, I want you to know that we are absolutely having those conversations about what does it take, what kinds of things do we need to plant the seed for today to be making those structural changes in the future.
So is that in writing? So is that written somewhere?
Yeah, well, and
You
part of
just
it is
shared with me.
ongoing conversations, with people of what do we really need here and there, and then having to prioritize those things, recognizing that obviously that would be a huge.
I think having that in writing, I think providing those level of updates, like you just said, that specific number of the basic needs of what they would do, that I think will go a long ways in helping us to understand, because as we continue to move forward, and we have new people that's going to come in, right? Term limits. Mm-hmm. It's the reality of what we're going to be facing for the next term. We need to make sure that we, to me, lay the groundwork so that we do not turn back the clock. Mm-hmm. That's important. I cannot say that enough. We have definitely begun to gain some traction, and I will hate to see all of this work, all of this time and energy that we have placed into this in terms of protecting our most vulnerable population to be rewind, because some people just clearly may not understand, and I think having it in writing and maybe coming back in maybe 6 months, not something that you need to give us an update all the time, but letting us know kind of like where you are and where we are in the timeline of ensuring that this keep moving forward.
Yes, ma'am. And the other thing that I want to say is that we're also continually working with Casey Family Programs to determine how does child welfare as a practice need to change. And so we have seen and are continuing to do work with Casey and other places to see how we can actually close the front door a little bit, where we're getting people resources that they need. And so those calls are not coming in necessarily unless they really are allegations of child abuse and neglect, not there's a child that needs resources, right? Which is why the 211 is so important, but is also why community programming is so important. So last week, we went to the kickoff of what we call My Community Cares. This is a prevention program. We also have 2 other prevention programs that have been pushed from the federal partners to be prevention, right? So this is where child welfare is moving. Preventing children from coming into care, preventing children from coming into
I see it, yes.
DCFS. And so My Community Cares is our initiative to help mobilize communities, churches, community groups, nonprofits, local agencies to support and strengthen families. So the vision of My Community Cares is for children and families to have access to services, activities, programs, resources, and supports in their communities where they live. And so we've been working on a no wrong door strategy. 2-in-1 and some other things are a part of that. But this whole family approach of My Community Cares, this project is about really every family being able to believe my community cares about me. Right? I can find resources in my community. So we had a successful pilot in Caddo, East Baton Rouge Parish, Livingston, and Rapides, certain zip codes in each one of those parishes where we had evidence of higher numbers numbers of families coming into our vision for various reasons. So now we have identified 9 My Community Cares lead agencies across the state. So we're taking what we learned, digging it down deeper in the first 4 parishes, and then moving it throughout Louisiana. And so we're in the process of going through contracts with the 9 lead agencies. And last week was the 5-year anniversary of the Family First Prevention Services Act. That was a great time to be with our My Community Cares partners across the state as we move this effort so that communities can see the families and children in their communities, and those communities can see the other helps that they have in the community so that they're not coming to DCFS's attention as there's a problem with the family, right? They need resources if they can get that help. And so there were some very inspiring stories from judges about how My Community Cares has been assisting them in their caseloads, redirecting families to resources in their community rather than into the state's custody, et cetera. And so we believe that the more that DCFS pushes the work as one of many at the table in a community helping a family, that's the better Louisiana will be. DCFS is not the answer. We have a role to play, but we are not the answer. We all are the answer, and communities have to be looking out for communities, and it's going to be more important now than ever. As you said about the fentanyl crisis, as we talked about at the beginning about the food crisis or the food insecurity that we will see more of. So.
And that's good. I'd like to learn more about Baton Rouge, and we can talk offline about that. But as a part of the pay incentive or a part of the structural change, and I'm not sure if this is the right place I was trying to see, have you guys decided about the 2-shift or staff to work nights so that the folks
So we have a
can
contract right now.
Okay,
to
so
pilot
so
that.
we're piloting it now. Okay.
Piloting it right
Okay,
now.
okay.
You wouldn't be surprised to think that a contractor would also have trouble hiring, would you? That would make sense, right? So hiring and retention is just as important for every other contractor and every other employer out there. So we're seeing their turnover as well. We've trained their people to come in at night. We've trained them to assist us in various ways, and we've also trained their turnover.
So that's something that you're looking at to see whether or not this could be a part of that structural change.
Yes, ma'am.
Okay, great. That's it for me right now, Mr. Chairman.
Very good question. I guess just to dovetail, and then we'll turn over to Senator Mizell, but just to dovetail, I think every industry right now is looking at, okay, what immediate salary adjustments I need to retain the staff that I have and to recruit them. So with Senator Barrow and Senator Boudreaux sitting on Senate Finance and the budget can be amended, I mean, they have that opportunity. What you ought to do is, as you talk to Senator Barrow about, is the long-term strategy. You probably do want to have a crisis model of this is what I need to fill the gap to be at least in the marketplace right now. And I think every business is doing that study. I mean, everybody's saying there's a delta. How much money is it going to take? So I just don't have an exodus of people that are going to go somewhere else. And as you all said, leave for $22 an hour, less stress. When they knock off, they knock off. So I think if y'all could come up with that number and bring that to the finance committees, because this is policy, so this is as far as we can go with it. But I think I'd really appreciate what my colleague's saying. I think she's saying, hey, I sit on Senate Finance, give me some data.
Yeah, thank
So
you, Chairman.
just from there. Senator Mizell?
Thank you, Mr. Chairman. Thank you, and I appreciate your comments. You had my mind going. Before I get to my question, I just want to tell you I had my LA in my district office call 211. She got a rapid busy because, yeah. And then when she got them, they gave her 5 resources for Washington Parish. So thank you. Yeah. So
Thank you.
you have said many times, and I appreciated your candor in saying it, the kids are not okay. And, you know, Senator Barrows felt the pain in her district. And I'm sitting here and I'm thinking, you drive the ambulance that rescues the child from these horrible situations. But when you mentioned the Casey Foundation, what are other states doing that gets it on the front end? Because we keep trying to enhance our back end or make it where we can sleep at night, okay? But on the front end, we've all talked about early childhood education. We've all talked about maternal health. We have an opportunity to change that parenting role because, and I guess I'm preaching, but I really feel it in my district. There's a cycle that creates the environment that we keep putting these children into care over and over, just, and we're lucky if we can just get them into care. I mean, you're doing all you can to find all that. What do you see? What can you tell us that would weigh what we try to do to put something on the front end?
Yeah, thank you so much. And I know Amanda's like itching. Misprevention, right, for the state for a long time. I want to just start the comments by saying that prevention is important. And prevention means community, and prevention means resources, right?
Right.
And so that being said, we have done in our legal department and our programs department, policy is looking at various ways that maybe we might be taking some calls that we know are not child abuse and neglect. If we can get the education of people to understand where do you call when you need resources, if I'm a teacher concerned that Johnny comes to school dirty and hungry, that may not be neglect. They may need resources. We need to get into the teacher's hands the resources. Part of that is 211. Part of it is more, right? Part of it is also why we have this contract coming to assist us with getting education out. And that's what that contract is for. That's in one. How do we educate people as to how to call 211? Or in this area, there is a nonprofit that is going to provide resources to the school in the districts where we know that things are happening more and more. For example.
What about I'm not to interrupt, I'm very aware of my time.
Oh, yeah.
The actual parent that needs the guidance, that has the child that's hungry and dirty.
Yes.
Who goes and schools that parent?
Yes. And so parenting initiatives are part of the resources that we
Okay.
have available to us. And so there are some times that I actually interacted with a woman, she's of age now, 3 weeks ago, who told me that she was the snitch for her family that called and went to school and raised
Every
her
family
shirt,
needs one.
right? And showed teachers that dad was really strapping them in ways that was abuse. And they got removed for 7 years from their father, who went to parenting classes, worked his plan, got his kids back, and was the best parent after that. What I'm saying that to say that parenting does matter, and we need resources to do that. And so in multiple of our programs, we have parenting resources. Doesn't just have to be through child welfare, right? And so that's why, for example, employment and training programs are very helpful, right? Because even through the wraparound services that we have in child support enforcement, also can bring about a parenting class. And so people can get to parenting classes without necessarily being on our caseload. So we do have to figure out, are there ways to get people resources before they come to us? But if they come to us and what it really seems is like this person really doesn't know how else to parent the child, sometimes people will say, okay, the agency put us in a family services caseload and is sending me to a parenting class. I should do that. And sometimes they're like, I'm not doing that, right? And then we work with the courts to try to get them court ordered to go to classes. And so if we can plus up opportunities for people to understand what is abuse and what is not, and that there are parenting classes. And there's a helpline that parents can call to say, I'm at my wit's end, I don't know what to do with this child, I'm about to throw up against the wall. That's how I would feel sometimes about my daughter. Now, I never threw up against the wall, but I felt like it once or time, right?
I feel like I haven't made my point.
Okay.
I'm going to back up.
Okay.
Because this is where I was going, and I appreciate everything you're saying.
Yeah.
I think what I was trying to, my hope is that there's got to be a mechanism that allows a parent to be ready for parenting, just like we want a child to be ready for kindergarten.
Right.
Not when the child already can't read and we're remediating. Not remediating.
Yes, ma'am.
Putting that mindset in. And maybe I'm an idealist, I don't know. But I believe that there are states that may have been in situations like we're in that found some sort of a way to make the parent, I've been working with I've got a bill on maternal health, so I'm hung up on that. But to have someone at the point of pregnancy where you're able to give them counseling not only for their wellness as a pregnant woman, but for their wellness as readiness to be a parent. At some point, there's got to be an opportunity to break the cycle of abuse or neglect.
Yes,
there's
ma'am.
got to be an opportunity, and I don't want to tie. I may have already tied
Sure,
it,
Amazo,
but
you're
just offline we can talk about it. There's got to be other states that know how to do this. That we keep trying to do it on the back end.
The federal government has identified several programs that have to do with like visiting, like nurse visiting programs.
The nurse, the whole
right?
Yeah.
And there's more than one, right? There's several.
Doula. I've told the magic word is doula. That's what I've been told.
There's actually several of them.
But we don't have a working doula program.
Right. So we do have several programs, though, that will allow visitation of the child and the mother to be able to help them learn how to parent and how to deal with the child.
I just want it to be where they don't call you.
I
We
need
never
to.
need to bring you into the home because
Yes,
the
ma'am.
home is working. And that, anyway, thank you, Mr. Chairman. Thank
So
you.
in our nurse family partnership program that we have,
Right,
that we
I saw
fund with
that.
TANF, right, that goes to LDH, which is a much better knock on the door than the DCFS knock.
But they're working for you right now, aren't they? In nurse family partnership, don't you have? He's not.
We have nurses.
Yeah. Okay. We'll talk about it. I'm
Yes,
sorry.
ma'am. Okay.
Thank you.
Louis, get a tranquility pillar for
No,
get a tranquility pillar for our pro tem.
tranquil. This is nothing to be tranquil about.
No, I'm just teasing.
Absolutely.
No, I appreciate your passion.
Don't want any water.
You okay, Senator?
I'm fine.
Okay. All right.
When the kids are okay, I'll be better.
Okay, Senator Barrow.
Amen. When the kids are better, we'll be better.
right.
The doula program, she said it's not working. It's not working. Is it
Okay,
not
so the
working?
doula program would be a LDH
It's
program.
not us, but I think we just don't have a real network and structure that supports doulas in the state of Louisiana.
So Assistant Secretary Brunson, as you may know, used to be over the Women's
DOLA
Policy
program.
Office at the governor, so has lots of information, and we can get with you as much offline.
Okay.
And I do appreciate, and I should say this, that Secretary Phillips has been an amazing partner with us as we have continued to look at opportunities for crossover at the department
Okay.
and with us.
Okay, thank you.
Thank you. Good questions. Okay, so let's go to page 2. So on page 2, it looks like, and I want the committee to jump in if these are some hot topics for you, but it looks like on page 2, you pretty much either accomplished everything or you have working lines of communication. I guess my one question, and then we'll turn over to committee, but we'll just kind of look at it globally. But I do see on L where you've raised the average daily rate from $15.20 to $19 to retain foster caregivers with compensation. Did that move the needle? Did that help? I see you accomplished it, but what did it do?
I would say that it did help, absolutely. Foster caregivers were very excited about that. It still doesn't cover the cost to be a foster parent, obviously. But placement is a big worry. I mean, we need more foster families. And so I'll take this opportunity to make that plug that anybody who feels called to do this, please absolutely reach out to us, because I think all across the country, we saw a decrease in foster homes, especially tied to the pandemic. People were scared to have somebody coming in and out of their house, and kids who need to visit their families, and caseworkers coming in. And so that is still absolutely a need for us.
So when I do see a dollar bill like $15.20 to $19, the reason I'm kind of focusing on that is, as I said once again, with Senator Boudreaux and Senator Barrow next to me, they sit on Senate Finance, and I see in the session this discussion is going to move to Finance and Appropriations. So I guess what I'm saying is, I would recommend taking our punch list of what we've accomplished together and mutually to basically say, here's what we accomplished, but here's where the funding gap still is. That way, with their expertise on this committee, it just does help the financial discussions. So just wanted to throw that out for y'all, because I think this discussion is going to move to a different committee in a different way. I see the board is clear on page 2. Why don't we go to page 3? And I see the first thing to attract foster caregivers that you do have in red is the contract with communications firm, and that's ongoing from page 1. That's
It
the
is.
same.
It's the same contract.
And that's also to help us with recruiting foster families as well as staff.
Right. So I guess that execution is kind of critical to get that communication out
Yes.
there.
Yes.
Okay. Then we still on that. Let's go to number 2, the disciplinary response with key partners. Why don't we talk about the memorandum of understanding with East Baton Rouge Pilot, and let's talk about that a little bit.
Yeah, so it's a real shift for us to think about how do you have all of these community partners come together, literally be co-housed together. In certain cases, we work them together. And so this has been a real intentional, slow process to have everybody understand what's my role, what's your role, to get over any fears associated with maybe people getting out of their lane. And so that's been a facilitated conversation that's been very effective. And the instead of an MOU, it's really called a charter agreement. We're in the second round of like, here's a revised copy. Everybody's looking at it. Legal departments are looking at it. That's why that one is extended beyond, you have some entities that it just takes longer to do review of agreements like that than it does for others.
Okay. Let's talk about C then also, improved teaming, response and investigation, special investigators, because that was talked about a lot. I think y'all talked about the Texas model. Y'all kind of said, hey, maybe that's going to work. Why don't we talk about that a little bit?
Yeah, sure. So that was something that initially we were like, this is great, right? You have a couple of former law enforcement maybe who are hired to work within the department and work certain cases. So as we tried to launch all of these, 40 some odd things at the same time, the person that we were working with in Texas had some kind of family emergency or something and was no longer available to us. So when we realized that, it was right at the time that we were really ramping up the child protection model. And those relationships are improving. The work is happening differently. The ability to work cases together with law enforcement is changing through that pilot. And so we've just kind of said, let's hold off on the special investigators while we figure out the pilot through the child protection.
And more meeting schedule, I see, on that one.
Yes.
Madam Vice Chair, all yours.
So, so I'm gonna ask you, Mr. Chairman, just in case I missed my areas because I didn't mark them off.
Oh, no, do what you got to do for your area, please.
Because I do have a few questions that I want, like, updates. So I'm going to talk about some of the agreements. And you talked about everybody working in the same space. And I'm not sure if Youth Villages is a part of that network. Are they?
Youth Villages works with us in various ways. I don't think that they're in this particular
Not part of that
space.
model about working the investigation side of cases together. They
So
work
tell me
with us in a different
what's their
capacity.
role then?
Yes. So I'll ask Miss Christy Tate to come up. I know that she works with them the most in their start, but we work with them very well when it comes to those who are in extended foster care.
Good morning.
Good morning.
Barron. Okay, so Intercept, they are, I'm
Morning.
sorry, Christy Tate, Department of Children and Family Services. Intercept is currently, Secretary Ricks is correct. They do work with we use their model for our extended foster care program, but more recently we've contracted with them and other providers to work on the prevention side for children entering foster care. So we're now also in some areas of the state using their Intercept model, which works with families to try to prevent children from coming into care, and when a child comes into care, to speed up that reunification back with a family. It's still an evidence-based model. It's used across the nation. It's been deemed as well supported through the Clearinghouse, which is the kind of federal body that's looking at those evidence-based models and rating them. So it's one of the well-supported ones. And just because of our work with their model previously on extended foster care and the rating it got from the federal partners, we brought that here. But they, in 4 areas of the state, we're actually contracting with Youth Villages to provide that model, which is their model that they own. And
Which areas? I know Baton Rouge is one.
Yes,
What are
ma'am.
the other 3?
It's Baton Rouge, Covington region, so pretty much all the parishes in Covington they're serving, and then Orleans region, primarily Orleans Parish and Jefferson Parish.
Okay, so kind of like where we've seen the uptick.
That's right.
Okay.
That's right. And we also have it's the first time they did that in our state. We have a contract with another provider who's using their model with their guidance in Caddo Parish. And so as we roll this out statewide, we're going to do a request for proposals, and we'll have multiple providers who are using that model across the state.
And so you've been using it how long?
It's been about a year and a half.
Oh, okay.
Not in Baton Rouge. So we rolled it out in Orleans and Jefferson first. And really we started on contracts about a year and a half ago. So probably about a year that it's actually been, the services have been in place. Second, we rolled it out in Covington. Third, we did Caddo. And then more recently, because of the crisis in Baton Rouge, we put a team there.
So in Caddo, though, it is another provider who's using their model, right?
That's correct.
Okay.
Yes, ma'am.
And so far, that's working?
It is. It's working well. That they do that already with their YV LifeSet model, which is what we use for extended foster care. They have not done that as widely with their Intercept model, so it was kind of a pilot, and it's worked well. We've gotten good referrals and so far good outcomes. That one's been in place for. They've been taking cases for about 7 months.
Okay. So when you say Intercept, is that the name? Is that the name of the organization or the name of the program?
That's the name of the program.
Okay.
So in Baton Rouge, Youth Villages is the organization that's providing Intercept, and they also own that. They developed that model.
Okay. All right. Okay. And I may have further questions about them a little later because I'm just going to talk a little bit about partners. So I'm going to talk a little bit about mental health. And so we talked about that in terms of the MCOs. Have we been able to work through that issue? And now we're making sure that if a child comes in and they're needing mental health, then that's being addressed?
I would say we're continually working that through. So we have work groups that have been set to determine, where we have a process issue. For example, through our work, we work with 3 of them. I think we talked about that. We work primarily with 3 MCOs for children that are in foster care. In this work, one of the outcomes was a decision that we would not immediately change a child Medicaid provider or MCO to get to a preferred provider for at least 30 days so that there would be a better outcome. There are other work groups going on. We're looking at, for example, when we have very difficult behaviors and a child might end up being PEC'd, how do we actually work on the next step down placement with them before they need the next step down placement? That requires the MCOs, LDH, and DCFS all to be on the same page and have a working model. So that's an example of something that is set, like, I think next week for a next work group. So I would say the work is continuing.
Okay.
And I think that what we're learning is that it's going to be continual. There's always going to be another thing that we'll need to address, but there are a litany of them. So I would not put it as a past tense. I would put it as ongoing.
Okay, so I guess my concern may be that as it's a continual work, people or children are not being delayed maybe in receiving services.
Well, sometimes there is a delay in receiving services because the children must get care through Medicaid, and sometimes there's no provider in their area, right? And sometimes there's a wait list, and sometimes so there are multiple reasons that a child might get some delay, and that is true even of the children that are in child welfare custody, as well as those who are not. So you would think, there are some priorities that could come for child welfare, but a lot of what we're talking about right now is what is it that allows for a child not to be in our custody to get what they need. So I think we all know that we need more providers throughout the state, particularly where we're a state that continues to be riddled with things like transportation problems. And so transportation issues throughout the state will continue to be an impediment for families to get drug testing, to get to providers that may not be in their parish, for example.
Okay, and you are absolutely correct, and that is very true. I just hope that as we're working towards that we are making that a priority.
Yes,
and
ma'am.
trying to, as we're working with the department, working with the MCOs, that we're working to make that an issue that we try to address as quickly as possible. Because when a child has already been traumatized and they need help, and then having that being delayed because whatever the situation is,
Yes, ma'am.
that just further puts them behind.
Yes, ma'am. And I'd also like to direct your attention to a program that is up and coming, sort of like My Community Cares, but a little bit different. Whole Health Louisiana is an initiative of
WHOLE or?
Yes. Initiative of LDH and the First Lady's office.
Okay.
That has multiple agencies. And the impetus is exactly what you said. It is about trauma. It's based on ACEs. It's based on collaborations. And one of the initiatives that I heard them talking about, or we were talking about, I should say, in a recent meeting, was that, like, getting providers not only to come onto Medicaid, but also those who have Medicaid to be trained in newer therapies that may be more beneficial to our clients.
Good.
Or certain
That would be good.
certain ailments that a child may be going through. So the efforts I see firsthand with the MCOs, with LDH increasing providers, increasing types of therapies throughout the state. So we are an active partner with Whole Health Louisiana, and I think it's something that if you guys don't have on your radar yet, it's a very good initiative. It is in its infancy, but I was very glad to be at a kickoff meeting in January, and there's a lot building right now.
Okay. I have 2 more questions, I think, Mr. Chairman. The other one, so you said something about transportation, And so that was definitely one of the issues early on that we talked about as it relates to transportation. And since going back to serving on finance, some of the monies that we have here, and I believe that initially when you guys did your budget, that was not included in terms of increasing your freight.
Yeah.
So I want to talk about that because that's important. And so
Yes,
what's the
ma'am.
path forward as we think about that?
Yes, ma'am. I thank you for bringing it up again. I know that maybe it was the last time or the time before that we had the Louisiana Legislative Auditors who did a review on your request at the number of cars, and I think it was an assessment that they made on if every worker who goes into the field had a car. And I think I saw everybody's eyes get really big when they brought the number. And so I welcome to the table our Undersecretary, Eric Horant, who's been working with, Dr. Horant's been working with one of our other contractors who's helping us to streamline some work in the department, and they did another analysis, maybe with a little bit more reasonable, maybe not a 1-to-1 ratio of cars to persons, but maybe a 1-to-2 ratio. And then we also have that broken down by different regions. So if we were gonna, plus up in a particular area, what would it look like? And I think that analysis came back to what seems to be a little bit more reasonable increase in fleet. And as he gets to that part, a recent conversation we were having about one-time monies and what could come to the department's aid as far as additional resources needed using one-time monies if they are available. Cars are in that category, though some portion, a smaller percentage of that of a portion of the purchase of vehicles would need to be included in the budget going forward for their maintenance. But Eric and I were talking about what a bona fide purchase would allow us to carry forward. Even if the car didn't come in immediately, you would still be able to get it, because that was, remember, one of the problems is that there were no cars to buy. But as we know that the market is opening up now a little bit, there's more new cars on the road. Maybe there's more availability now or soon. And so we probably can put that back on the table. Eric?
Yeah, thank you. Eric Horant, Undersecretary. I'm not going to try to get maybe too deep, but I go as deep as you want into it. So we looked at 5 regions because it's a lot of data. We looked at the use, of personal vehicle, mileage reimbursement. We looked at the use of rental. We looked at the use of the state vehicles. Then we basically analyzed how many miles, how often the vehicles are used, and what we're trying to look at is that a vehicle is used at least 1,500 miles a month. We don't want to have vehicles sitting, putting a couple of 100 miles a month, so we're trying to figure out how to maximize the fleet, that way. Based on these 5 regions, we have a need for around 132 vehicles, additional vehicles. So a vehicle, based on the numbers that LLA, provided last time, $27,000 per vehicle. That's usually what we pay. That seems to be the ballpark. That's a total of $3.6 million. 75% state general fund, so that would be around 2.7, state general fund. And then, like the secretary says, we don't want to forget you have ongoing costs. So you have insurance costs around $100. You have maintenance costs. Okay, that's going too deep here, but 7 cents per mile per vehicle, we analyze that. You have to pay for gas and things like that. So it's around $400 a month a vehicle, to maintain, pay insurance and things like that. So you have for all 132 vehicles, you have around $700,000 of maintenance, and that would be around $500,000, $500,000 state general fund.
So going forward, we are planning to actually make that request for at least some of that. That's part of the plan, because we know that there's still a need.
So we keep talking about it, but our ability to request things is over, right? So we're talking to you, we're talking to the administration, we're talking to the
Maybe I should
commissioner,
say, "Oh, you talking to us then?"
and we're
Making
talking
yes,
to you right now.
Yes,
I know that Senator Boudreaux put this on the table in the beginning, so we
Yes.
went back and at various meetings we're bringing the information requested so that you can take a look at it and assist us with determining with the current resources available to the state, is it the proper time? Of course, we always believe it's the proper time for reinvestments and new investments at DCFS for the children. But if you all are in agreement with that, we will work with you to provide every bit of information that you need to see what you're looking for.
Well, I am absolutely in agreement with that. And so, and if there's ever going to be a time for us to do that, it's now, because we do have surplus dollars that can be used one time, and these are the type of items that we can invest in. And I think that that's what we should be doing.
Sure.
The 5 regions, I know Baton Rouge and New Orleans. What are the 3?
I cannot remember.
Okay, well, you can give it to
I
me
know
later.
it's Lake Charles. I don't remember.
Okay,
I
okay.
am
And then it's
We-
just to
we're-
say that
I'll
they
say that.
only analyzed those 5 because that's what they had time to analyze, not to say that there's no needs in the other 4.
Oh, absolutely, I
Right.
agree. Because just because they are ordered for those 5 regions or whatever, it doesn't necessarily mean that they will stay in those 5 regions, right? If you have a need somewhere else.
Right, we would have to, we're always having to right size our
Right,
resources
okay.
depending on the data. And also there's some other things when the state tells us that, the rules say first use a state car. If you can't find a state car, then you use a rental. If you can't find a rental, then you can use your POV, personal owned vehicle. We know that there's just some places where people don't have vehicles, they get dropped off at work, and they don't feel comfortable using personal owned vehicles. And so we try to stay in this space, and if we use rentals for casework, we try to get them to be longer term rentals. But as you can probably guess, there are many of our offices that don't have a rental car agency near them at all. So we have to think through all that. And I think it's the administrative time of getting the car and keeping the car and going back and stuff that really kind of is difficult to deal with sometimes.
Letter bearer. I'm looking at it right now. Yeah, sorry. I don't think my mic. Oh, it's on.
It's
now.
on.
It's on. So we had Baton Rouge, Covington, Lafayette, Shreveport, Monroe. So that's the 5 regions we looked at. We actually didn't look at New Orleans.
Baton Rouge, Covington, Lafayette, Monroe,
Shreveport.
Shreveport. Okay. And then, so that's all, but I am absolutely in favor of that. So just in case anybody wanted to know, if they didn't know,
You'll hear
wanna
from
make
us
it known.
this week.
Yeah.
Thank you, Senator Barron.
And my last question won't be for you, Eric. I want to take you through the scenario now that you have the additional people with the level 1, level 2, right? So these are severe cases.
Let's get Mona.
Now, when a call comes in and we know that it is a level 1 or level 2, which requires immediate attention, what happens today? I want y'all to take me through that because
Yes, ma'am.
we just had, thank God the baby didn't pass, but we did have a situation where our baby was near fentanyl again. So tell me, what does this look like? And I know the other part that we never really talked too much about is the judges, which is another issue, in my opinion, in terms of how that's viewed and seen, and having kind of going through the court situation, kind of see it a little bit differently. But take me through what that looks like today.
Yes, ma'am. Thank you. So I've asked our Deputy Assistant Secretary, Mona, to come up. Mona, what's your last name? Michelle. I do the same thing to Ava, the one I didn't throw up against the wall. What's your name again? Sorry, there's too much going on in our minds right now. But I asked Deputy Assistant Secretary Mona to come up, Mona Michelle, to come up to talk this through with us. And I want to also just kind of say to you, Senator Barrow, that I'm so pleased at the progress we're making in Baton Rouge. Not only with leadership and the workers that are there, but also with some temporary workers that we have there from Ashley Sias's part of the house, our other Deputy Assistant Secretary, where we have workers from from family support, working in child welfare right now to bridge the gap until the new hires come on and are able to take the cases. The work that we're doing that Amanda talked about with law enforcement and all of that, and then the changes that we've been making with centralized intake. So Ms. Michele is the leader of the work going on in the field. And so because of that, I thought that she probably would be best to answer your question.
Thank you.
Thank you, Mona. Michele.
Mona Michele, Deputy Assistant Secretary of Child Welfare Programs and Field Operations. And I would like to highlight something first that is really working well. Assistant Secretary Brunson mentioned about the partnership with law enforcement, and I want to show you exactly how that's helping with the fentanyl crisis. Okay. Just last week, there was a case involving another child exposed to fentanyl. Baton Rouge Police, because of the relationships that are formed, directly called the regional administrator in Baton Rouge as soon as they got the autopsy results to make sure we had that information, we made that connection, and that we could work together on that case. So just to highlight, what we're doing is working. The relationships are being formed, and it's making a difference in how we work cases. And so to answer your question now about when a case comes in, it is assigned the response priority, 48 hours. Whatever the time frame is that is allotted for that case to make initial contact, and that would be initial contacts with the victims and at least one parent. The worker is assigned. We have a case assigner in place that we've talked about previously that ensures that the case is assigned timely and distributed to the supervisor and worker. The worker then proceeds with discussing with their supervisor, making a plan of what additional contacts are needed to make sure that a good assessment occurs and that safety is assessed. Once those initial contacts are made, those interviews, that's when the supervisor and worker get together again and say, okay, based on this initial information, is the child safe? Are there threats out there that's posing a danger to the child? If there's dangers, then we have to then look at, is there anything else that could be put in place, a safety plan, where we can try to maintain that child in that home safely with some support around them? If that's not available and the child is unsafe, that's when we go to the next step, which would be some form of court action. That's when we make that call to the judge, or we write the scenario up to the judge to say, we need you, we are requesting some form of court action, whether that be court-ordered services or oversight while we continue to work with the family in the home, whether that be requesting that custody go to a relative that we've been able to assess, or that custody come to DCFS, depending on the situation.
So, couple more questions then. So I'm glad to hear about the part that's working well with the police. So I'm gonna just kind of ask you about, what do you attribute that to? So was there some kind of training that happened with the police department and you guys, and so now?
That is the partnership that's being developed through the Child Protection Team and our joint work at the Family Justice Center. So we are meeting on average weekly with the community partners, so that would be BRPD, EBRSO, and the District Attorney's Office and the Child Advocacy Center. through those weekly contacts of looking at what our protocols are, how to reach each other, what barriers are you seeing that we can work through together, is forming relationships that are just going so far.
Okay.
And that's, to me, this is a direct result of that work.
And that's really good to hear. So, as it relates to the process, call comes in. You guys you realize it's 48 hours. Assessment needs to be done on this family. Goes to the caseworker, supervisor, and then if we realize that this is a very severe case, is anyone else notified? Does it ever come up to you, Madam Secretary? Like, is there a some kind of rubric that you use that when it comes up and it's pinged and it's like, oh, this is severe, we need to really monitor this, we need to watch this and make sure that everything that we have in place is actually done? Does it ever come up to you, like, in terms of notification that we have this case?
There are definitely cases that come all the way up to me.
Okay.
This is why the secretary doesn't knock off, right? Because they come at all times. And so those cases that come to my attention and the assistant secretary's attention directly, if we find that there is a reason for us to do a review of a case, this is something that we have changed since January.
That's what I wanted to hear.
That we would have a meeting. I forgot. I don't know what they call it, but I call it the secretary's meeting, where we have everybody that has touched the case, from if you took it at intake, if you worked it on one side or another, and we pull everybody in all the way through supervisor, manager, and we get on a Zoom and we talk about what's going on, what happened, et cetera, so we can make determination about what next steps. This is where I've said to you in the past that when things come to my attention, I'm looking for, is this a right versus right? Did people make reasonable decisions here? Or is it something that happened that is not right and that we need to address it immediately? We have a bad actor that we need to address. Do we have a stress system that we didn't know about? Whatever it is, we're doing a review of that crisis, and we're putting them into and we're all looking at it. Now, if a case doesn't reach to a near fatality or a fatality, I'm not going to usually not know about it. If it's the case is running through regular processes, unless we're running into a true impediment, and the staff would get up to Mona probably before it would get to even Amanda or myself, but usually it comes all at the same time. If there's a true impediment, for example, law enforcement's not working with us, or a judge is doing something really weird, and we had that happen recently, and you mentioned judges, and judges are very different. They run their courtrooms differently. They're the ones that make determinations about what is in the best interest of a child. And so if we have cases like that where there's really some impediment that's stopping the regular movement, then it will come to my attention. There are some times that one of you might bring a case to my attention for a review, and I certainly do review them at that time. And so even though there are very few cases that we're able to talk about publicly, if something comes to my attention, we do a review of it, we do a secretary review of it like that with everybody involved, and determine what needs to happen internally. And the staff have been amazing at that. The other thing that has happened, though, with that, and this is good for me and very difficult, is that I have been able to see firsthand exactly how the staff are impacted by what happens to children in their caseload. So when a child is hurt, when the staff is dealing with the very real difficulty of a child in their caseload, something happening to that child, and they would say, I have pictures of this child on my phone. And they're in tears talking about, whatever happened. And so that's been very good for me. It's also been very difficult, right, to be able to get it. But I think that's the only thing that'll make me a better secretary, is making sure that I actually understand from, the parents, the children, the staff, right, the judges. I'm going to court next week in Baton Rouge to actually be in the courtroom and see what it looks like in the courtroom from their perspective as well, and from the birth parents and from the foster care parents, right? And so we're trying to increase our access to lived experience, bringing that to us. I have people around me with lived experience helping me, and this is helping me in a big way understand a lot better what is going on in the field.
Yeah, you do have some really good people who are working out there who really care about the children.
They do.
They really do. And they go over and above, many of them, to make sure that they are taken care of. In the instance when the judge does not agree with your decision, what happened? I know what happens with the child, but in terms of legal issues, in terms of steps that can be taken, because at that point you're almost limited. What is it that we can do differently in that arena? Because that bothers me, because there are seemingly areas of our state where you may see that happen more often than others.
Yes, ma'am, and I invite our general counsel to come to the table. And since it's Women's History Month, I will tell you that she's the first woman to be general counsel at the department, Kim Glapion Bertrand.
Congratulations.
She's been there for a few years now, but since it's Women's History Month, I just thought I'd bring it out there. It is true, Senator Barrow, that the judge could make a decision different than our recommendation. Many of you would make a decision different than our recommendation, and sometimes you do, right? And so it's plausible that a decision different than our recommendation might still be reasonable, right? Because sometimes you're talking about a right. Do I go to this person who loves me or this person who loves me? And the judge might make a decision, right? That happens. But then there are some other times when a judge makes a decision and it's very clear to us that this is not in the best interest of the child with everything that we know about. And then we will take steps towards, the legal steps required for that instance. Kim?
Yes, I'm Kim Glapion Bertrand, the General Counsel for DCFS. And yes, if a judge makes a decision, as the Secretary said, that we are in disagreement with, and that, as the Secretary said, you can have right and right, because they could have reasons why they believe that their decision is correct, because we're not the only entity speaking to the judge. So the judge is hearing from DCFS, but they're also hearing from the child's attorney, the parent's attorney, CASA. So there's numerous people in the room all speaking to the judge. So he's hearing from all various parties who all have different interests. But when the judge does make a decision that the department truly feels like will put the child in real danger, we can then take writs on the judge, and that means we can appeal to the Court of Appeals. The thing about that, writs are not immediate normally, so it takes a while. So oftentimes that decision of the judge is still going to go into effect, and then we can appeal the decision. So that is something that we can do. That's not something that we necessarily do often, because there's a lot of factors that have to be considered in taking writs on a judge.
I'm just trying to see if I should ask the next question, but there certainly seem to have been in some areas where you will see a little bit more of that, and sometimes I think it's more about who you know as opposed to what's right and wrong, because it's not the two rights, it's what's right and wrong.
And Senator Barrow, I will say that the judges, right, just like every other employee, right, they grow in their knowledge of sync cases along the way as well, and we've seen that, and so we really hold sacred. We have what do we call the meeting with the judges? I always call it the judges meeting, but it's an organization of judges that comes together for juvenile judges, and we're there en masse to learn from, hear from, respond to, and also advocate for and educate the judges on issues related. And so we think that they're just a major partner like everyone else They have a different seat and a different role, but they're a partner.
Yes,
And so
I
we
agree.
continue to try to educate and learn from the judges, because sometimes they may be looking at something that we didn't see it that way, and so we try to give them more information and then glean more of their lived experience as well.
I thank you for that answer. Very good answer. Good response. But that's the other part.
Yes,
but I
ma'am.
understand what you're saying. But you're absolutely right. We need them to be a part of our team and be a partner. Yes. Senator Mizell.
Sorry, thank you. Quick question on my colleague's great line of questions. I appreciate that. Senator Barrow asked about the response time, and you said it was a 48-hour response time. I'm going way back to the beginning.
Some of them are, right? There's a risk assessment that comes in both on the level of the risk, but also the response time. So there's really two different analyses.
So when you're going through, you mentioned, and I won't go through the gist of it, but basically that everyone, that the taker of the call and the worker come together and you decide. But at what point are eyes put on the child, or eyes put on that home? What is that, within the 48-hour, or?
If that's the assessment that was made, and if we can meet the response time, which we really hope we can.
So if you get a call from an ER doctor and you know
Yeah.
there's fentanyl was present, whatever, and the ER doctor, which to me is beyond question, he's not calling because he's an angry neighbor or anything. Is that a 48-hour? What?
Actually, that's sooner. So
Okay.
when there was a reference to the 48 hours, we do have different levels. And so Assistant Secretary Brunson, I believe, mentioned that approximately 74% of our cases right now are within 48 hours, but that's within a couple of those categories combined. The first category is called a priority 1, and that requires less than a 24-hour response. And one of the changes made as a direct result of this experience and the Senate oversight is that with any case involving a child under the age of 3, with from a medical reporter, that is automatically accepted unless a manager reviews that and determines otherwise. And if it's involving substance exposure, that's an immediate P1.
Okay.
So we have made that change as
So
a result of this.
that basically is the utmost urgency at that point.
Yes.
Correct. And there are also times where even within that 24-hour time frame, with our partners, we will receive requests of, we need you on the scene right now, because it's a very high
Right.
conflict
Yeah,
area or
this is-
situation, and we do that as well. We're on the scene within an hour or whatever the case may be.
So are you seeing a heightened awareness within the emergency room personnel now that they're calling you faster? Are you getting more calls, or are you feeling that on your end with the intake?
We are definitely seeing that an increase overall in the number of intakes and the number of accepted intakes that we're getting, in terms of whether that's a direct result of the coming from the emergency rooms. I cannot say. We can
But
look
is it
into that
fentanyl?
information.
Is it all fentanyl related, or
No, we're
it's-
seeing an
it's just
increase
traditional?
across the board, from all types of reporters. But the majority of those cases are related to substance use in some way, but not directly related to fentanyl. But it is definitely impacting our work, the fentanyl, and we are seeing an increase in the number of infants and toddlers exposed to it.
Oh, I'm sorry to hear that, but thank you. I appreciate your comment. Thank you.
This was some very good, productive discussion, and I think that's what I'm so proud of the committee and the department to bring out these discussions, and it kind of just, instead of checking off more in the box, it adds more to-dos kind of to us, but that's just what we do. So why don't we do this, if the committee's okay with it? Why don't we kind of go through a lightning round with the pages, because it looks like I reviewed most of them, and it looks like you're hitting most everything, so why don't we do this maybe a little different if the committee's okay? When I get to the page, if there's something that a committee member sees or something you want to bring out that, hey, this is kind of keeping me up at night. We're not hitting our timelines. Maybe we'll do a lightning round and then have some more discussion. So we're on page 4, y'all. And page 4 is prioritize high-risk infant toddlers. That's A, that's B. But I see where it looks like you just have some minor delays, but it looks like you're hitting all your target goals on that. Anything you'd like to bring out on page 4 that would be more of a pressure point that you'd like for us to talk about or bring aware of the
I think
discussions?
We've largely talked about it. Like we talked about Intercept. The secretary mentioned My Community Cares. I think that's a really powerful program that we will all be excited to see grow and expand statewide, because it really is about, to Senator Mizell's point, about how we serve families without them coming to the attention of child welfare. You know, I think so often right now there's nowhere else to turn, and so people knock on our door about a family because they're just worried and they know that they need services. But My Community Cares is going to be a great opportunity for us to build out community partnerships and prevention on the front end.
Very good. Then if we go to page 5, I guess that's the part I think Vice Chair Barrow and myself have had a concern on. And let's go to page 4 where it's 4A, and partner with LDH and MCOs to improve services. And as we all remember, kind of historically, when we heard kind of that the former secretary said she was going to contract out with the MCOs, we all kind of, as a committee, came back and said, no, we already have that. Let's see how we can kind of just build on what we contractually have out there. Tell us where that's going with that, because that's a critical piece.
Sure, and I do want to point out that the reason it's red is because we changed the wording in that one, and I wanted to flag that change for you because it used to say something about leveraging workflows and training, but it's beyond that. But that work really is. It has kicked off, I would say, to a greater extent in February. So as the secretary said, we really are just ramping up that, but it's really in-depth, very specific conversations with the with LDH, with the MCOs, with our judicial partners to say what are the needs across the spectrum of child welfare services, where's the low-hanging fruit, where maybe services already exist out there, they're Medicaid eligible, we just weren't tapping into it. So we're having those conversations, and then the future phase of that will be, okay, what's left that was not Medicaid eligible that maybe we need to look at, how do we contract with certain entities to get these services. So those conversations are starting to ramp up right now, and I find that they're really promising.
And then I guess I'll look at B and then turn it over to committee, but it looks like improve health services, additional medical services, solicit providers, develop contract proposals. That's ongoing right now.
Well, that's the piece that I pushed. Originally, we were thinking we were going to be doing that around now, but really we need to explore the rest of what is Medicaid eligible first, and so we turned those red because we pushed them into the next fiscal year.
And next fiscal year. Okay, so and that'll be that's in your budget. That's in your proposed
Well,
budget.
that's the exploration to start about. Okay, we've looked at what is. That's when exploration would start next fiscal year.
But I see you see solicit providers as needed, that you funded on that. Then.
We've got to figure it out, I think, of what that is, what it looks like.
Okay, I got
Yeah.
you. I got
So,
you.
but we're where you guys are, that we believe that the majority of what we need is in the MCO contracts. We just need to make sure we're pulling it in and pulling it through.
Very
So
good.
to the off chance that we find that there's something that is not that we need, through our conversations with Secretary Phillips, the staff, and the MCOs, we've also determined that there's already within the MCO contracts an opportunity for sort of like other needs,
Very
right?
good.
And so I think that what we're finding is that more of what we need is in there, and that this exploration is lending itself to really helping us understand maybe there's more in there than we thought.
A lot better than when we first started this discussion.
Yes,
Very
sir.
much so. Anything else, y'all on that page that kind of shoots out at either the committee or the department? Then if that's the case, we'll go to the next page, and I think that's the last page on there. It doesn't seem, as I reviewed it, anything you want to bring out on this?
The only one that's red on this is the National Partnership for Child Safety. That work is still continuing, just in a little bit different way. And I don't think it's formed up enough for us to give you explicit key tasks and timelines on it yet. But we are working with the University of Kentucky to look at how are other states reviewing critical incidents and how can we learn from them and build in the right data systems to track them and things like that.
So
And
you
it's
don't-
important to know that this is part of the Casey Family Program work, that they're supporting us in this. And they are the ones that pull the resource up to help us understand that this is probably what we need. It's a next iteration beyond the secretary's call, where we pull everything together and figure out like what happened, what do we need to do about it immediately. It's going to give us an evidence-based way to do that.
So I'm going to turn over to Senator Barrett in a second, but to wrap up the spreadsheet, and she may have some questions on it. I guess from a standpoint, and this is just a 50,000-foot question, but from just everything we've been working on, and Madam Secretary, from when you got involved in you and your staff, and we always say that we want to thank all the workers at DCFS at every level, and this is always, we felt, has been very productive to just move the needle forward for everybody. So this has always been a situation where we're very appreciative for all of your work. What would you say kind of does keep you up at night, that's on that spreadsheet, that you say, you know what, if I don't hit a home run on that, I'm worried for the department, I'm worried for the future? Because we did talk a lot about a lot of things, y'all are checking off the box, a lot of things doing, but what is that big picture item as the head of that department that it gnaws at you sometimes?
Chairman Mills, it is the caseloads. We definitely need more people to handle the crushing amount of work there is to do in the department, in particular in child welfare.
So what's the ratio now? If that was, and I'm gonna turn it over.
So
to
the
you.
ratio of caseload, like I would be able to turn that over to you, but and Amanda, when she talked earlier, and when she said if I really did the caseload analysis to determine we would need 300 and some more workers, I think that's where she got to. I think when we've been looking at this, I had some statements in here where we talked about the caseload standard has been and is 10 cases a month for an investigator.
10 new cases.
10 new cases a month for an investigator. We have workers with 21.
New cases.
So what happens then is they go, yes, I feel called, but I can't do it. So nobody wants to do a job that they can't do
Correct.
well. So what keeps me up at night is that we have people that want to do the work, but they feel like I cannot do this work. Not because I don't want to do it, but because you're asking too much of me. And I think that the thing that hurts me the most is when people say, you're asking too much of me, and I know it's right.
Yeah.
And it is because unlike most, businesses, we can't shut the door, right? We can't turn off the lights. We can't say, we're filled right now. And so our policies where we can figure out where are those prevention services, how can we narrow the front door of people coming to us, that's one way, but then also making sure that we have enough caseworkers to handle the work while the work is high, and it is high right now, and that's why I wanted to go over that with you when we started about, we're hiring more people and they're coming, but they will run, and we saw that in New Orleans, that when we made the change in policy and we took more of those cases that were coming from the emergency rooms or et cetera, right thing to do, what happened? The caseload went really high. People who were like, okay, I could do this, I got it, and then they got 21 cases, new cases instead of like 12 or 13, and they're like, I can't do it. So that's what keeps me up, sir.
I guess the analogy is not a good one, but I guess my personal one, and I know Senator Pope will appreciate this one, but when I was a little boy, my dad used to bring me to LSU games, and the demand was maybe 60,000 in the stadium, and more people wanted it. Now the demand is over 100,000, and they're still filling it up. Mm-hmm. So if we can keep adding to Tiger Stadium and taking care of the needs of the sporting community, I think you just got to show your case of the caseload is more, the demand's more, the complexity is more, and I think that discussion has to go to Senate Finance. But what I'm hearing from you is you can check everything off the box, but if my caseload has improved, has drastically increased, then something's gonna give, and it's at the expense of people. My last thing, and I'll turn it over to the vice chair, but I guess what I'm trying to get to is sometimes independent people have to verify your pressure. Has the legislative auditors kind of looked at your caseload, at the demand to report independently to the legislature and the people that look at this, that your numbers are verifiable, and have y'all joined forces on that?
So the legislative auditors just love being at DCFS. So they've come for multiple reasons on both the performance side, right, as well as the fiscal side. And we welcome them, by the way, because we always learn something from them. And so I know that we've had a performance audit recently in there. We can talk with them. We can talk to the Senate fiscal staff. We always try to work with the fiscal staff on both sides of the House here. But also, the head of Casey Family Programs has also said he would come and testify directly to assist you all in understanding from a national perspective, where is Louisiana, what are the things that'll make a difference. And so we plan on taking him up on that, not only to help us with the work on policy and practice, but also advocacy.
Well, what we'll do is, I know Ms. Cannon and Ms. Peck, we work really closely with the Legislative Auditor's Office. We'll kind of reach out to them to just look at your numbers and independently verify it, because that's your story.
Yeah, I think they'll be in the building next week for some other issues, so we can probably
we'll kind of
talk
make
to
that a
them
priority
then.
of the committee.
Yeah,
We'd like the committee to know
absolutely.
that. I'm going to turn it over to Senator Barrett. So it looks like we got our punch list done, and just so everybody will know, we do have some folks that would like to testify come here from Louisiana Elite Advocacy Force. So we'll do that as soon as we finish our line of questioning, and then I'll maybe have some parting comments on our committee work and where we go with that. So before we do that, Senator Barrett, it's all yours.
I wish I had to ask my question before you ask your question.
I'm sorry.
Because that was to me a good segue to go into the public comments. But I was trying to figure out who Dr. Gary Malone, I guess if I'm saying that
Gary
proper.
Mallon?
Mallon. Because I was trying to see if that was the same consultant that you had used before, the agency I used before that insulted us. But I was able to find him, and that's not him. I was, because that was probably going to be an issue. Secondly, technology. We didn't touch upon that, but one-time dollars in terms of technology, we are moving along. I think that we're making great progress, but every worker that's in the field, they have access to the technology they need to be able to
They
do their
do
work.
have access to lots of technology. The quintessential thing that they need is a child welfare information system that is connected.
That's
You
what
might
we're working
remember
on,
that
right?
we were working on that, and then there was a decision to stop that work, retool it, and to start again. So we've been working directly with Office of Technology Services, but in the meantime, bridging some work. We have been working with Deloitte and OTS on bringing in some immediate changes to a system that was bridging us to a CWIS system. And that work is ongoing right now. We could talk about it if you'd like. We could talk about it online. But I did appreciate both OTS and Deloitte for making very quick starts on some low-hanging fruit that we saw. They actually, Deloitte, within a business day, sent a team of people down and sent one of their employees out into the field with our workers to ride along with them and
That's
see
great.
exactly how we use the technology. And actually, sometimes you don't know what to ask for because you don't know what's out there.
Yeah.
So to have them ride along, they could then pull other resources that they knew could help us. And so that's been going along, right? So there's, it takes a little while to create the different, I forgot, it used to be Erds and Birds, and now they call it something else, where you sit and you do the user stories and you figure out exactly what needs to, but they are doing it, and we're very grateful for the partnership.
So I was just trying to see if there were any additional opportunities with the surplus dollars that we can make the work easier for the workers in the field. But I've heard the story from Deloitte, what they have done, and I am appreciative of that. So I just want to touch bases on that.
Yes, and Senator Barra, Dr. Horant was just reminding me that we have put in a supplemental request because
Okay.
some of the things that we've been doing in the 7 strategies were not budgeted for.
Right.
And so we have made known some supplemental needs that could be some one-time dollars, and so we're working along through the process with identifying those needs as well.
Well, please make sure you get them to us. Thank you.
Um,
We got it. We, y'all, first of all, we want to hear the public testimony, but I
Yes.
kind of want to wrap a bow on this one, y'all.
Yes.
So if the committee's okay with this, I want to commend your team, the committee, Ms. Peck and Ms. Cannon, and just to give an oversight is, we started this in September. And I think we've made tremendous progress together as a team, and I think it kept us all accountable. We learned a lot from you. We met 4 times since then, and the session's getting ready to crank up. And I know your focus is probably going to have to be on finance and explaining your budgetary request. And I know Senator Barrow and Senator Boudreaux is going to be very busy on that. So I'm going to throw this out to the committee. If you disagree, fine. We'll take a break on our every 6 weeks while we go into session. Once session's over, then why don't we regroup? We'll be seeing each other on a weekly basis. Why don't we regroup? And if we keep this thing going for the calendar year, I think it's very productive. Let's keep the lines of communication open, though. If you see
Yes.
something that's causing you some discomfort, get it to Ms. Cannon and Ms. Peck. We'll get it to the committee. We'll keep the communication going. While the session's going on, if we do see something's on fire, or we do see something that either side has the need to meet, we can do that. We can do that in the committee hearing. Is everybody okay kind of with that plan? That's a great plan. Everybody's okay with the plan? Y'all okay with it? I know y'all not going to be too disappointed to meet every 6 weeks.
Senator
but
Mills,
I'm
we
just-
actually love seeing you guys. So,
Okay,
but
go
we know
get
we're
the
gonna
lie
see
detector.
you a lot all through the session. We'll see you all through the halls.
We'll
and
see each
all
other.
the different places.
We'll see each other a lot. So on that note, unless the
Lots of
committee has
places.
anything, let's hear what the team from Louisiana Elite Advocacy Force has to say. And thank you.
Join them, and thank you very much for your interest and assistance. Of course, our doors are open, so any conversations that we can have, and working with your assistants and everybody else, Senator Mills, Chairman Mills, boy, I can't even imagine this committee without you sitting in that chair. So we won't think about it right now.
Well,
We just want to say thank you to the
It's
committee.
been fun. It's
Thank
been fun.
you.
And
Thank you
y'all,
so
let's
much.
just hope we don't have 18 hurricanes to talk about. So let's just keep praying. Let's say a bunch
There's
of
no
novenas.
hurricanes, no hurricanes.
No hurricanes, no floods,
hurricanes.
no nothing. Just good weather.
Yeah.
Good weather. Yes.
Thank you.
So thank y'all again. So we look forward to hearing from the Louisiana Elite Academy Force. The floor is yours. And just introduce yourself and tell us a little bit about the academy, the advocacy. I'm sorry. Whoever wants to be first.
Oh, okay. Do I need to put a left close? No, is this all right?
It's perfect.
Okay, thank you so much. Good morning. My name is Antonica Frazier. I am the LEAF Vice President, as well as a Lived Experience Engagement Specialist with the Center for States. And we are here today to share a little bit of information about LEAF and our partnership and collaboration with DCFS. And just to provide a little bit of background information, we were once formerly known as LILAC, which stands for Louisiana Youth Leadership Advisory Council, which was established in 2007 and serves as the official Louisiana State Youth Advisory Board at the time. But then in July of 2019, a group of dedicated young adults decided to come together to reestablish LILAC under a new name, LEAF. And so LEAF stands for Louisiana Elite Advocacy Force. It is a board composed of young adults with lived experience and DCFS liaisons utilizing youth voices to advocate and inspire change in child welfare across Louisiana. Our vision is to create a world and community where every child has the right to safety, a loving home, permanency, and overall well-being in life, which they are also able to build a beautiful and successful future for themselves. Our tagline is utilizing negative experiences to facilitate positive changes for foster youth. But I think the tagline can be changed to utilizing lived experience, because it's through our lived experience that we are able to empower those around us to continue to strive for changes in child welfare. Throughout the year, LEAF conducts 4 retreats a year, monthly meetings, and 4 in-person work days a year. But over the past 5 years, LEAF has grown significantly, from passing Senate bills to implementing the Bill of Rights and recruiting new members to join our board. I will be passing this over to my colleague, Roshan, to share a little bit more about the purpose of LEAF and why we do this work.
Hi, good morning.
You did great. You made an A+. I'm glad your phone battery didn't go out.
Yeah, I was over here like,
Yes, ma'am.
oh, it's not morning still. Okay, I'm sorry. I was going to say good morning. Okay. Well, good afternoon. My name is Rashawn Allen. I am Lee's peer mentor, and I'm going to start off with why LEAF is so important to us. On our board, we have young adults with different lived experiences from different regions. We strongly believe if we can unite our voices and continue to advocate for those who are in care, we can continue to make a change and be a role model for all youth so they can gain a voice also. LEAF has 4 active committees, starting with Policy Committee. Policy Committee is working with to disseminate friendly Bill of Rights. We partner with DCFS state office staff to ensure that policies are with youth, are youth-centered and led, and youth-led, so that every voice is included. Along with place stability, purpose is to ensure that tools and best practices within the department are healthy placement arrangements set into place to ensure that youth have a smooth transition into the system and have a smooth transition out also. We also have state board structure, ensures that the board has continued to stay stable and updated. This committee helps the board to strive in all diversities of all backgrounds, expertise, and perspectives. We strive to ensure that the narrative around foster youth is truthful and speaks to its audiences and in a resourceful and positive light. I'm sorry.
You're doing great. You're doing great. You're doing a lot better than a lot of people do here. You're doing good. Take your time. You're doing good. Take your time. Enjoy that moment that you get. There's a privilege to speak in front of the Senate, so take your time.
Thank you. We also have a media committee. We're able to work with DCFS staff to fully update the Youth Link website. We partner with DCF also to ensure ongoing updates and revisions in DCFS Youth Link website. We ensure that youth content is steadily updated so we can provide to youth upon entering and exiting foster care. Okay. LEAF has a different representation also. Every member have on board, every member on board is unique and comes from different racial, religion, and cultural backgrounds. We all have a story, which we are able to give some different opinions and voices impact changes. Diversity is key. For example, some of us still are raising our siblings. Some of us have physical health issues. We have experience in detention centers. Some of us also have children of ourselves now. Yeah. We all have different, all of us have different office. We advocate and for youth and care because we show them that we are represented and they're not alone. And I'm going to pass it to Aaliyah.
Thank you for your testimony. Thank you.
Yeah, that was amazing. My name is Aaliyah Z, and I'm serving as the youth ambassador at this time with DCFS. And, I've worked with y'all in the past, but I just want to take a moment to say that I'm truly proud of this board, Louisiana Elite Advocacy Force, which a lot of y'all formerly knew as Lilac, but everybody on the board is a former foster youth. They have truly grown in magnificent ways. They have blown us away at the department in the ways that they advocate across the state. Some of our members have even traveled outside of the state and work alongside federal programs now as well, informing different policies and practices in we all partner regularly with the department, you know, to work to improve things and make changes and things of that nature. So I'm just very proud of them. Like Rashawn said, everyone comes from different backgrounds, but united, you know, we come together with one sole mission and purpose, and that is to improve the lives of our children and families here in Louisiana. And with that being said, I'm gonna go ahead and turn it over to the president of the board, Keedy. She had to leave. Okay, that is okay. No, this.
We good. We
Serious.
good.
Okay.
We good.
Because
We
it's
good.
okay. I know the information, y'all. So we'll go on and move forward.
We good.
Let me see.
Give me one second.
Or actually, we good to go. I understand what we had to talk about. So like I was saying, we partner regularly with different organizations such as Casey Family Programs, nationwide, as well as the Pelican Center down here, Crossroads NOLA, CASA, on-the-job training, you know, workshops with DCFS, working to train the
I
new
think
workers.
your president's back.
Okay, great.
So you can stop
Good.
tap dancing. You good.
Okay, cool. All right, so.
This is a team effort for sure.
It's good to see y'all laughing and so happy. That's good. So,
We're absolutely a team here.
Yes, so-
Thank you so much, Aaliyah, and everybody.
so fill in the blanks. Tell us what we want.
Apologize for my tardiness. I am a mom, and some things just came up emergency for my son at school. So I just had to handle that. Gotta be a mom first, you guys.
Yes.
I mean, that's what we're here for, children and families, right? So, but hi, everybody. So my name is Kiana Bradley, also known a bit nationally and around our state as Keedy, is usually what I go by. I'm the president of our Louisiana Elite Advocacy Force Board, as you heard Aaliyah and some of my other colleagues have said before. We used to be LILAC, and LILAC used to be a thing since 2007, when it was established, and now we're 2023, still moving forward, steadily growing and moving, and we redeveloped in 2019 to be LEAF, to just redirect, do things differently, and to make sure laws, policies, and procedures represent the perspective and the backgrounds of the young members and children and families that we serve. Other things I just wanted to touch on about just like our mission, we call our mission to be ACE it and always ACE, which is advocate with current and former youth to unite voices, change policies and laws and perceptions in order to empower youth to be able to reach their full potential and to become the successful leaders that we want them to be. LEAF operates off the National Child Welfare slogan, nothing about us without us, because you need the youth voice and that lived experience there. And as you've heard, my former colleagues been able to talk about things and ways that we've been able to collaborate as far as nationally and statewide with the state of Louisiana. We have just make sure we're trying to strive and collaborate with those our youth and families and having lived experience at the table who face adversities in the Louisiana system that we've been talking about today. So some of those organizations or work groups we've been able to collaborate with. So one of our committees would have been State Board Structure and Training, and as Ms. Amanda Bruson talked about earlier, those OTJT sessions, which is on the job training within the DCFS department, we've been able, I sit at those meetings every Tuesday, so that's from 9 to 10:30. At those, they are training those workers, which is if it's CPI, if it is family services, if it is those workers that are working with the youth that are coming in foster care as well, making sure that they understand when they're going out in the field that they are capturing everything that they need to be able to serve those youth and families. And I'm so happy and honored that I get to be able to sit on those calls to have lived experience voice to tell them how it was for me, how it is for the young folks that we serve and has been a part of LEAF and those other current members that are out there right now in the system with DCFS. Other ones is Louisiana CASA. We've been able to partner with to make sure youth who have a CASA, they've been able to advocate in the best interest for those youth. I've been able to do trainings with the executive director for the Louisiana CASA, and we've been able to be at those meetings to talk about why it's such a need to be able to represent those youth in court and having that person in court.
So, and just specifically, New Orleans CASA and St. Bernard CASA have absolutely called us to be on like those panels. I've been at those panels to talk to those advocates that are being trained why it's important to be an advocate. And at also all this working with the department, DCFS, and other stakeholders like CASA, like this work is not for the faint at heart. We all know that. So we definitely try to make sure that that is ensured during those calls. Other groups that we've worked with is the Pelican Center, which is like a multi-collaborative like effort within the state of Louisiana. We're talking with them, talking about why youth voice is needed in the courtroom system, talking about why it's important, because youth are a party in their case. It's not just the parents, it's not just CASA, it's not just DCFS, but youth need to know that they are part of their case plan too, and that if we're saying like, hey, this is what your parent needs to do, this is what DCFS needs to do in their court report, this is what CASA needs to put for their best interest in the court report, we need to also make sure the youth understand like, hey, we want you to do your best too and get good grades. We want you to be able to have normalcy, be able to go to those activities or be a part of activities or clubs that you want to be a part of in class, to be or in your school or whichever school that they are in at the time, or any educational programs that they are in, to be able to have that. Crossroads NOLA is another that we get to work with and be on those panels. They're AJH panels, which means a journey home trainings. We get to sit with them when they are training foster parents too as well, to be able to those foster parents that are getting trained so they can understand, hey, this is what you may have to work with. And the state has took on an amazing initiative back in the back years of QPI. And QPI is the Quality Parenting Initiative. And it is really amazing for bio parents, foster parents, grandparents, all those caregivers to work together with the DCFS department, with CASA, and they just need to understand it's all for the youth in those families, whether if it's reunification or if it's adoption, or if it's just going with those grandparents. We all need to be able to be on the same page in the benefit of the child. And other ones, My Community Cares, what the department have said, we've been asked to be a part of My Community Cares, which is also helpful when talking about prevention. So those families understand and they know that not only when do you come into contact with DCFS, but we try to fix it on the front end too as well, with prevention of services, and having Leaf there at the table to talk about those prevention services. Like if a parent ever said, hey, well, I'm telling you right now that I don't have any food in my home. Are you going to take my child away? Well, let's have that conversation with them to say, well, let's put those resources in place, or talk to them about the resources so that they know what is out there to be able to help them. So it helps with the prevention of them being involved with DCFS. And I mean, One Heart NOLA, others, James Samaritan, Empower 225, Louisiana United Methodist, Goodwill, those are some of the providers that we've been able to be in contact with, and specifically Empower 225, Louisiana United Methodist. It's also been with Goodwill. Those are the ones that are independent living providers with the State Department with contracts, who would be able to show those youth the independent living skills that they need to be out there on their own. So I heard some of you guys, I think it was Senator Mizar earlier, I wrote my notes, I'm a note taker. You talked about maternal health for youth, even with independent living skills, some of those things, because we know sometimes youth have children, they're able to capture some of those skills for those youth with those independent living services, as well as being able to live on their own. So they're able to capture some of those ideas and those concerns for those youth who have that. And then I know Senator Pope, you also was talking about the trainings. Again, that's with the OTJT, and it's really making sure that they are equipped to go out in the field, but also making sure there are, during some of those trainings, some of the ones that they do get to talk about is cultural competency, making sure that they understand that you may be talking to families of different ethnicities, like different cultural backgrounds, different cultural expectations, and they get to capture that on those calls. And if that's not brought up on those calls, then I get to bring up that on those calls as Leaf, and being a great representation for youth and lived experience there to talk about those concerns, to make sure that is brought up for those families. And just like as far as ethics within the department, they get to talk about that on those OTJT trainings, and even LGBTQ concerns, because it absolutely is a thing. It's absolutely a conversation that has to come up, as well as young fathers, young mothers is a concern that they also talk about on those calls and serving those different populations, as well as sometimes undocumented individuals that we also serve down here too as well, and the concerns that they have too as well on those calls. So we always try to make sure all the different different populations that we serve and that we get to represent on our board here is covered, and we always try to ace it as best, which is advocate, change, and empower. So, we always ask for, the legislators and anybody that we come into contact. We just want to always encourage people about the information that's out there, the trainings that are out there to be involved in. Louisiana Child Welfare Training Academy that's out there. Make a Mood account and be able to capture some of those trainings, or look on the Claro website, some of those trainings. I always try to invite people to Together We Can conference to hear about, which is happening in November 2023. I think, if I'm correct, and sorry if I misspoke, but I think it's November 8th to the 9th of this year. So I ask people to come to Together We Can. Leaf usually always has a session there to talk about things. Last time we did placement stability, and we're hoping to do it March 1st with one of our partners, which is Empower 225, March 31st. So we are always out there, always willing to advocate, make sure awareness is out there about the issues that are going on with youth and families that are facing adversity in Louisiana. And we just encourage other people to ask questions, want to know about the resources like Senator Mizell and Senator Mills and Senator Barrow talked about earlier. And it's all for the improvement of children and families that is in the state of Louisiana.
Wow. Thank God you showed up. Wow. Wow. Let's give them another big round of applause to this young lady. Thank y'all. I think Senator Barrow, traditionally, and she always does, she could put a bow around the discussions, and then we'll adjourn. Vice Chair, it's all yours.
No, thank you so much, Mr. Chairman. I do want to thank all of you for coming, and it's so good to see you. Atanika and Kitty and Aaliyah, and I was looking for Jarvis. Normally Jarvis is here, and so Rashawn, is that correct? Welcome aboard. I think this is my first time meeting you, but I want to thank you, ladies and gentlemen, for in Jarvis' absence, for the great work that you continue to do. How many members are on your board?
As of currently right now, is 16 members, because one will be coming on with one of our providers getting sworn in. So.
Now, I applaud that. I really do want to thank you for your consistency and being at the table and making sure that the voice is being heard, that you're standing up for the children who cannot speak up for themselves. And so I do want to definitely applaud you for that. The Pelican Center.
Yes, the Pelican Center.
Okay, where's that located? I'm not familiar with that.
We usually do our calls like on Zoom.
Okay.
But they kind of live in different areas and different places throughout the state of Louisiana.
Okay, because I wasn't familiar with that. And then Together We Can is an upcoming conference?
Yes, November 8th to November 9th. And you can absolutely put it in Google and it'll pop right on up. And it's what they usually do like every year to make sure our legislators, stakeholders, attorneys, lawyers, DCFS, CASA, usually everybody have a session around things that we could do better in the state of Louisiana for children and families to serve in those populations. Yes.
I'm going to make sure I put that on my calendar. So as we have had a very lengthy discussion, I know that you guys have been staying abreast of everything. Is there anything else that you would like to add in terms of things that you would like to see, things that we need to do, anything else you want to add? Because you did have a lot of recommendations earlier. You're going pretty fast. I'm going to have to go back and listen to it. But is there anything else that you would like to add? Anything else that you have observed that needs to be maybe added or at least thought about as a part of our discussion?
Yeah, I would say as far as just making sure those lived experience voices are absolutely at the table. So that doesn't just mean former foster youth or just the youth, but also those, like I said, those grandparents, those bio parents, those foster parents at the table to understand what they also experience on the front lines with having a youth in their home. And when we're talking about prevention of services, when parents are coming to us asking us for resources or asking us for the help that they need to take care of their children and care, and be those caregivers for them, I think we really do need to accept the feedback more from them to understand what they need and the services that they need. And I think sometimes, and maybe that's a bit too far of a reach or stretch, but sometimes for the Louisiana Department of Health, sometimes I think for them, when they're serving the different populations or the different cultural experiences, understanding like different cultural competence like around that. So like for WIC, for an example, like for women and children's, we need to understand that not only certain foods that certain cultures may want to be able to have. So we need to make sure that's within the vendors that are at the stores right now too, as well. So if somebody's of like Latino and they may want different foods, they may want to eat different things, and based off like sometimes with WIC, we may need to be able to recommend those things for them to be able to make sure they're provided for and their children are provided for. And that's just as an example of different experience and different ethnicities and different needs that they may want and need.
That's good recommendations. Well, again, congratulations. And so I know that you have a son.
Yes, Josiah.
How old is he?
2.
Wow.
Yes.
Oh my God.
He'll be turning 3 in May.
Oh my God. That time goes by so fast. And Atonica, you have a girl?
I have a daughter. Her name is Jasmine. She's 21 months old.
Oh my God. Y'all making me feel like I'm getting
Sweetheart,
old. Right?
as she can
See,
be.
like yesterday, I remember when you were pregnant. We're actually both of you.
Yes, I was toddling over here. But I do actually have something I would like to add as we were listening. I think one of the things also is to think about generational trauma and curses that can transcend into how parents raise their children. It is reflected. I think that it's not always taken into account to think, well, what did the biological parents had to go through during their childhood, during their adult life, and how did that transcend into how they raise and treat their children? Thinking of certain, preventative services that could go into play. Definitely think one of those could be something that is trauma-informed related, something that is a course or training that biological parents can actually take for themselves to overcome their own trauma, because that's not always offered or available to them. They might also neglect the help because they might not feel like they need it or know about it. Not enough awareness that is brought to the table for that, which I think is something that could also be included as well. Another suggestion I would add, and it does not necessarily pertain to preventive services, but more so pertaining to children and youth and child welfare. Thinking about when a youth comes into child welfare, what services are available to them that provides them support as they transcend through their journey throughout foster care. I'm not familiar that there is a lot of mentorship programs that are available for youth in care, but I do think that could be something later down the road in the future that could be created for them to be able to provide them with the guidance and support that they need, to be able to get the permanency that they need, and to be able to receive any other resources that they would need to be able to transition safely and effectively into adulthood as they enter out of care.
I'm sorry.
Very, very good. I'm glad I asked that question.
Very good.
That I feel like that was like a bonus that we received. In addition to that, are all of the members from across the state pretty much?
Yes, from all 9 regions. So they cover all 9 regions.
Okay.
And so they can either come on 2 ways with the board. Like I'm talking about our hiring process. But they come on 2 ways. So they're either, it's like by word of mouth, they see our flyers like off the DCFS Youth Link website or based off our social media, whether it's Instagram or Facebook.
Wow. Y'all have social media too?
Yeah.
Well, right now. Okay.
Follow
I'm going to
us.
follow you.
But if it's either through like social media that they see it or through the different independent living providers or through the DCFS workers if they are in EFC or if they're currently in foster care and going to be aging out soon or not. They could, follow us that way. We get a notification that they want to be a part through that way, or they get hired on through the independent living providers that I mentioned, and they get to be a peer support or administrative reviewer, and the administrative reviewer works with the EFC youth and come on, or as far as like being a peer support at the independent living providers, helping with those independent living skills for the youth that are in care. Yep.
That is wonderful. When you are in this work, oftentimes sometimes you don't feel like you really are making a difference.
Yeah.
But I have to say, seeing you here today makes me feel like this is something that I feel like we truly made a difference in. Hearing your voices, hearing that you are actively engaged, that you are part of the process, that you are weighing in, it gives me some sense of solace in knowing that this is something that truly is making a difference. I can see the evidence of this being a game changer for those young people. So thank you, Mr. Chairman. I'm so glad that they're here. Thank you, Madam Secretary, for bringing them here. It gives me great joy to see y'all today.
Amen to that. And I will tell you, while you were all testifying, I could see very much of the DCFS family shaking their head, either in agreement or they picked up a new idea, they did something. So I guess I'll wrap this up on kind of just maybe something to make us feel good a little bit. I just got out of pharmacy school and I went to this seminar, and they had this speaker, and there's about 200 people in this room, and he walked in and it tells you how old I am. It was a blackboard with white chalk. So for y'all that don't know what that is, we'll tell you. And Senator Pope knows. So anyway, this speaker walked in, and it was a big board, and he walked in and he put from 1 to 100 the numbers. And he asked the 200 or 300 people for a comment. And the comment was, and it was right, you forgot the number 7. He said, no, that's not correct. So the next comment was, well, your 9 looks like an 8. He said, no. He said, more comments. He said, it's all up here. What comments? Well, your 10 looks like a 13. And they kept on. He said, I've heard you for 10 minutes. He said, I got 99 right, and all y'all concentrated is the one I got wrong.
Yes.
Well, I'll leave on this note, and we're going to be seeing each other. You all get a lot right. We all get a lot right, but it's our job to concentrate on those one things that are wrong, and that's what we did in these hearings. So we're going to continue to do that. We'll continue to work together. As our vice chair said, and I see the nods on this committee, you give us hope for the future, and you are our future. So on that note, motion to adjourn by the vice chair and unanimously carried. Thank y'all all.
Thank you so much.